Hello, everyone. John Atkinson here again, doing another interview on the Circumcision Harms docu-series that I'm planning on putting together. I'm here once again with JP. This is going to be part 2. You can look out there for part 1, where it says circumcised male nurse talks about the harms. So we're going to continue down the list of items. So welcome back, JP.
John, thanks for having me. Good to see you again.
Me too. Just before we started the recording here, we were chatting a little bit about how looking at porn is very educational about this topic. But when you go into watching porn, you kind of have to know what to look for, because most of the time, from what I've seen in porn, they usually don't show the intact men with a flaccid penis, right? They always show him with an erection on, and usually with everything pulled down, so it looks like a circumcised penis. And then we kind of went on about how, you know, the people that are probably the most educated about this are gay men that have dealt with both, and they've taken some time to understand the differences in how it works and everything.
Yes, I think that's absolutely true. Having watched a lot of pornography for educational purposes only, of course, yes, you will find that in modern pornography, it seems that the majority of men are uncircumcised and just erect, and they're retracted, and you don't see them being covered. They don't have that type of activity. It's usually, oral sex or something like that, and stimulating the exposed inner surface of the foreskin. And then the outer surface is then, down all the way by the shaft, and is practically not visible. So you're just seeing stimulation of the inner foreskin, the frenulum, and the bottom, the preputial opening, which the rigid band, which is the most sensitive. And so that's what you're saying. And it's very obvious, the difference in orgasm, the difference in ejaculation. Intact men have a much stronger, longer orgasm and ejaculatory series, I've noticed. Studies should be done on that. I think that would be immensely obvious.
Yeah.
Right away.
Some people will say that Jennifer Bosio did a study, but you look at the study, the quality of the study is really poor. It doesn't really get into that sort of level of detail. There's no, nothing monitoring the brain activity or anything like that. It's very, very, very simple, very, very limited in how far that study goes. So.
Yes, as we talked about last time, there's absolutely no incentive for the urological community to want to, engage in starting any kind of studies into the intact penis. I have seen there are some doctors who will do foreskin sparing circumcisions, where they'll try to amputate lower shaft tissue in a sleeve technique, but that's very rare. But at least you do start to see some signs that they're starting to recognize the value of the prepuce in modern medicine.
Yeah,
and
it might be possible that outside of the U.S. that urologists or urologist organizations might do these studies. For instance, I guess I can't remember exactly which country it was. They did a study to determine how likely a man would ever need a preputial amputation or circumcision in his entire life, and they ended up with like 1 out of 16,000 possibility, which is really low. Right now, some people argue that study isn't all that great either, but everyone can say that about pretty much all the studies. But that study was done outside of the U.S. So what's the chances a study within the U.S. is going to do a study that might prove any kind of harm? Probably low.
I can tell you in my career, and I started back in 2004, I have seen one actual urological emergency related to the foreskin. And it was treated simply. It was an intact man who had, a case of phimosis, presumably. He was retracted, and he had, I'll just, for the layman, it was stuck back. He couldn't get it back up. And the physician who was on practice called in a urologist, and I recommended, why don't we try an ice pack? And then you can use some pressure and just forcibly get it back over. And I actually spoke to the man and told him, if the urologist gets here, he's going to tell you he wants to circumcise you. And when he heard that, I was educating him kind of in private. He didn't want that. So he elected to have the auto,
Auto circumcision.
Replacement done. And it was simple. You simply deflate the glands, and then you're able to get the foreskin back over. It's just a simple manual technique, and you can avoid a circumcision. Right. And they would never say to the man, let's just do it. We could do a dorsal slit and avoid the circumcision, or we could simply, even amputate simply the preputial stricture, the phimotic ring. That's never recommended in America. The most simplest basics. Yes. I mean,
that's why
it's so simple.
Right? It gets stuck behind the ridge, right?
Yeah. So, yeah. I mean, and so in every case like that, they'll recommend circumcision. No, you could recommend, say, we could try to manually replace it, or if that doesn't work, we could try a dorsal slit. It's not optimal, but you'll have all of your prepuce. Yeah. And if you want in the future, you can get it, surgically replaced. You could sew it back together if you want, Yeah. So there's always ways to avoid circumcision. But if circumcision is your only, go-to, then that's all you're going to see. And that's the only thing the statistics will, demonstrate. And that's where we are.
Yeah.
We are in the dark ages of foreskin science, anatomy, medicine in this country.
Yeah.
And it's strictly, in my experience, for political reasons, for reasons of people fearing for their professional standing, not seeming anti-Semitic. Anytime I would speak with doctors about the subject, it would always turn to religion. They would always start to mention, well, the Jewish faith would do this for X, Y, Z. Yeah. And I'm thinking, how did we get into religion when we've started talking about a medical issue here? So
yeah, exactly. I was actually chatting with another nurse recently, and he says that he regularly gets into it with doctors about doing this to baby boys and everything like that, and how he argues. Anyway, that's a whole other conversation. But you were saying about how they're trying to remove less nowadays. Since we did our last interview, I
remove more actually.
Okay.
Well, yeah. There's some doctors who will try to remove less.
Yeah.
But there's a doctor who is now trying to circumcise pretty much all of the inner mucosal tissue, all of the frenular remnant, like they would do, like they would do essentially to treat premature ejaculation. Another condition that's not really an actual condition. It's a made up term, by society. But by doing that, like we were talking about last time, the very base of like the inner foreskin where it meets with the glands and then the frenulum comes down, they will amputate all of that tissue, absolutely all the inner foreskin. and connect just the bottom shaft tissue right to the glands.
Yeah.
Yes.
All of that freehand.
Exactly. And you'll see they'll show the results. Oh, yes. Now it takes the guy 4 times longer to reach orgasm. And you'll see the picture. I mean, and they look ghastly. I mean, if you're a person who's an intactivist and you know, I mean, when I first started becoming involved in intactivism, intact penis looked strange to me too, because I'm an American that's, you know, not used to seeing it. It takes a little bit of time, and then all of a sudden it just looks like a human body. Same thing with an infant, you know. That's that little kind of hurdle we have to cross with people to get them over their fixation to circumcise, is their own, you know, auto disgust mechanism.
After 16 years of studying this, now seeing a penis look like this when it's flaccid, that's what's disturbing to me. I've kind of flip-flopped on that one.
Yeah, and dildo, if you look at dildos, they're all uncircumcised and just retracted because they all have a frenulum. You know, you could always tell right away. You know, they'll think they're, you know, it's a circumcised dildo. No, that's actually an intact dildo. It's just retracted.
And it's kind of ribbed more, and you see the, you know, the stuff coming down from the frenulum, spreading out and all that. You just have to know what you're looking at.
That's it. Yeah, like you say, intactivists, we can, you know, spot an intact penis retracted in a second, whereas even doctors, you know, they can't. They're so ignorant to the anatomy. It's, you know,
it's crazy. They don't spend enough time at all in medical school on this topic, so it's no wonder. In fact, recently there's a TikTok, a couple of TikTok videos. This nurse in training or doctor in training. Anyways, it's a young woman that's in medical school, and she spoke up about, you know, circumcision, and she, you know, is spouting off all this misinformation, and she clearly lacks knowledge on the anatomy and functions of the male prepuce. So, you know, she's definitely getting pounded on by intactivists on TikTok. So.
You're right. I mean, if you can't, you know, if you don't have the basic knowledge, how can you give your patients informed consent and give them proper advice? You can't. You're simply a butcher. You're, you know.
I don't understand why people see these things that talk about the medical benefits, but they just stop there. It's like, okay, so you're finding these medical benefits are being put out there on the internet, you know, about reduction of this, reduction of that, but you don't take the time to say, well, okay, so we're talking about cutting off a body part in order to get these medical benefits. What is that body part? What does that body part do? How is it innervated and vascularized, and, you know, how does it feel to, you know, the men that have it and all that? Do these, you know, all the men in the world, you know, why aren't they all lining up to get this done if it's all that great? They're not.
And that's why when you start to educate, you expose their basic ignorance, say, okay, let's begin. What are the structures and functions of the prepuce? And let them begin, and they have nothing to say. And then you can start with your long list of things, and, you know, then it could essentially go into a day of education, you know.
Which and we're not getting paid for it, right? They should be getting this from college where they're paying for the information.
There should be beautiful sculptures behind me. And I mean, you know, for the amount of time, I've probably put in, you know, an equal amount of time, you know, intactivizing as I have working, probably much more even, you know, since when we come home, what do? We go on the computer, our phone beeps, you know, we comment on something. Our blood pressure goes up, you know, another month comes off of our lives. You know, what we go through, you know, it's you know, it's a little unrecognized, you know, benefit to society. I love intactivists. You know, they're the most open-minded, smart, you know, educated people, unique people. When I first became involved in intactivism, I was so despised by American society. I almost wanted to start like our own village just be away from cutting society without having to move away from this country where, where we wouldn't be able to help people.
I was actually thinking that'd be great if we had the money to do a like a camp thing where we all get together just once a year or something like that, and spend a few days together, playing games or whatever, or we can even do things together to do intactivist projects or whatever, just as a getaway to some camp somewhere.
Right, like a convention. What's the most modern, the newest information coming out,
Yeah, I know they've had, like Marilyn Milas's organization would do things once every other year, and they've been trying to do another. Intact America is trying to lead another one, but the pandemic is getting in the way. But they all that they do is they get together at a hotel, and they have people do presentations, and that's about where it ends as far as I'm concerned. I did a video I posted on TikTok yesterday where I took a cardboard box. I should print out another piece of paper, and then on the cardboard box I put a piece of paper on it that said, genital cutting rituals that are performed in children, and I listed off all the different kinds of names that are used for those rituals, katan and katna, and on the very bottom I put circumcision, right? So I listed all these other ones first. Hopefully, people won't like to shut off as soon as they use circumcision. They'll read through the other stuff first, and they'd be, like, well, yeah, we shouldn't be doing this. And then it pans out and it sees me in the bloodstained men outfit holding a shovel, and I smash the box. So it's like I would love to just get a bunch of intactivists together where we all do things to destroy this in a symbolic way, and that was my symbolic way of destroying genital cutting rituals that are performed on children. So.
I think that's great. I saw a picture of an intactivist lying in a grave in the bloodstained men, suit, essentially, and I'm like, that is wonderful. I would like to have my gravestone made, now. I'll just leave the date open, but said, was killed by circumcision, essentially. Because whatever's going to kill me, it's going to come back to this in some way. The stress of having done this work. People watching this who are new to it, God bless you. You have no idea what you're getting into. It's going to affect your life. You're going to do a lot of good. And so it's worth it. I hate to say that there's a disposable generation, that there has to be, that, we're going to have to go through this and be pissed off and, go through what all circumcised men go through, but it is what it is. You have to get over it. As the young generation becomes educated, and it's, there's so much more education, I almost fear what's going to happen when young men become educated and become very angry about this. And I think that might, bring about an end to it quicker too, when, young people are on TikTok and on social media, spouting out how pissed off they are, if they have the courage to do so. But with the lowering of the circumcision rate, it's going to become much easier to do it. Especially with the proliferation of, podcasts and, Conan and, having Brother K on. What was the show he was recently on?
The comedy show. Gosh, I'm going blank on. It was down here in LA too.
But yeah, Main Street,
Tosh.0.
Tosh.0. Yeah. Exactly. I mean, there you go. You have another million people who've been, at least, made aware this issue exists. And, some men are pissed off, and, initially it might look a little crazy. A guy in a red bloodstained suit, they might think, oh, this looks a little strange, circus-ish, cultish. But, it brings in people, it gets the message spread much more than a person, say, just in, scrubs would. At the beginning, I had the thought to myself, I'm like, is this the best way? Because it has this kind of, like not circus-ish appearance, but like not professional. Like I always thought it would be better to have doctors standing out there, but that wouldn't be shared. And blood-stained men realized that. And, I think their approach was exactly correct.
It's interesting that you bring this up because this was tweeted at 11:03 a.m. yesterday. Well, of course, I don't know what time, probably my Pacific time zone, by Intact America. I guess they did another opinion poll this year, and more than 22.5% of respondents favor boys keeping their foreskins, up from 16.8% in 2019. So in just a couple of years, it's an increase of 25%. So, hey, intactivists, we're making progress. That's so heartwarming to hear.
Yes. And intactivists believe, I think a lot of us do, and, something called, the tipping point, like, I think I said last time, like we're rolling a boulder up a big hill, we're almost at the top, and pretty soon when we get to the top, it's just going to tumble over, and it will become, so much more normalized, all of a sudden now there's so many more intact guys, women are exposed to it. It's destigmatized, and then there's going to become almost a reverse shaming. You're going to have so many more circumcised guys very upset, and then that will lead to the end of circumcision. That's going to be the history of it. There's still going to be.
I think it'll lead to the end of all genital cutting rituals across the world. When men realize the harm that has been done to them, it's going to end FGM. It's going to end IGM.
Yeah, I hope so. It's with what recently happened in Afghanistan was very discouraging. Seeing how people can allow ignorance to so easily overcome them. I hope. Off topic a little bit. There's been 20 years of Western society in that country. I would hope the 20-year-olds would, pick up one of the AKs around in Afghanistan everywhere and say, F this, we're not going to allow this to happen in my part of this country. And I think that's going to happen. It's a prediction. We'll see.
Cross fingers for sure.
Cross your fingers. Yep.
I don't know. That's a whole other discussion about how religion can get really steeped in and all, but I don't know. Let's cross fingers. I
think that's going to be the vestiges of it. It will be the religious circumcisers, and that will go on. Yeah. It will take a lot of legislation and brave lawmakers to finally end that at some point. But hopefully it'll be through education of the parents who say, we've given up all of these other religious laws. We could stop this one too and come up with a brit. We'll do the brit shalom. That sounds nice, Yeah. And I would say it sounds like a great ceremony. You have the same party, the whole family comes over, and the best part is the guest of honor gets to go home with all of his body parts and not in pain.
Yeah, I'd be all for that one.
Yep.
Especially the food.
Absolutely, I'd go. Sure.
Yeah. All right, so we left off talking, or we were getting into myotitis or meatal stenosis.
Yes.
We had covered. I think we kind of covered that as we went on, but the whole idea is that and it seems like I think that every circumcised man that was cut as a baby has a certain level of this, because you can go onto circumcisionharm.org and you can see an image where they're showing two penises, one intact and one not, squished a little bit, and you can see the urethra, the opening of it is very, very different, very obviously different.
Yes, and in my opinion, that picture doesn't show the difference nearly as much as you do when you see it firsthand.
Really?
Yeah, it's so much. It's such a greater difference. I mentioned in the last show, I thought I was seeing men who had their urethras torn open, great and wide by trauma. And no, I was just seeing the natural intact glands. And the development actually looks so much different also. So The comparison photographs, where you show this is, the circumcised glands at 40 compared to an intact man. Those are great. I like to show comparison. It's hard now with, media or, to do it. Everything gets blocked now, but it's extremely obvious. The keratinization, first of all, is so obvious, but in every circumcised man, you will see some degree of stenosis. It might be a severe case, you might be able to have seen that they have had a repair done, or it just might be a severe case that's been left as is, or any degree thereafter. I believe that it's related to if the frenulum is left intact or not. I think if the frenulum is not excised, if the artery is left intact, that there'd be a lower cases of that. There's a study that should be done, as far as when parents are, talked into this, informed consent. Meatal stenosis, I don't think is something that is brought up as much as it should be. That should be highly emphasized, that your child has either, a 10% chance of requiring surgical correction for this, unnecessary cosmetic procedure we're about to perform. But they don't emphasize that, of course. They, we know how the game is played. It's very simple.
It really surprises me that urologists aren't seeing this. As many penises that they look at, they don't see the obvious differences between the glands of the guy that was cut as a baby versus the intact ones. It's like, hello, it's smooth and moist, and the urethra is larger. I don't know why this is. Maybe again, just like you're saying, it is for professional reasons. They're keeping it under wraps and all that.
Professional and for personal reasons, and their entire career of brainwashing that keratinization is better, or because they actually in their calculations, if it takes you twice as long to reach an orgasm, they'll actually say, oh, you have twice as much pleasure, and it's like, no, that doesn't seem to make sense to me. If it's it's hard for you to get off, you're not feeling much. Because it's taking you twice as long, you don't get to calculate that into your statistic that no, it doesn't reduce sensitivity.
Yeah.
And you'll find that when studies are done, and it does show that it takes circumcised men significantly longer to orgasm, they will then in their paper say, but this is a good thing. They will put their own 2 cents in, their own opinion into a paper that it's a positive that this result has been achieved. And, so that's what we're dealing with.
Yeah. Often what I normally bring up when it comes to this whole argument about PE is like, well, okay, so even if an intact man doesn't last as long as one that's not, the intact man can usually recover a lot faster than the one that's not, because they haven't dealt with so much friction, and so they're not worn out as much. So
yes,
yeah, if they recover faster, then that's good for what's good for the goose is good for the gander, right?
Right. And watching Glenn Callender on the Canadian Circumcision CanFap, we talked about last time. He did not seem to have any refractory period between his, I think, 4 or 5 orgasms in 3 minutes. So you could do some studies on refractory times between circumcised men and intact men. There's another study that you could do that would blow this out of the water. I mean, just here in the show, we've, talked about a few things that would already, if publicized, make circumcision, a thing of the past.
Sure.
So.
All right, you have anything else to say on meatal stenosis?
Just that, in my experience, I would say 100% of men who are circumcised have some degree of stenosis. And nurses don't recognize it. And I think it has other effects, because you now need to use a different size catheter. Now there's going to be more, pressures, there's different things involved now. If you use a different size catheter, it could have different rates of infection. It could have different, effects otherwise. You could have actual tearing of a stenosed urethra if you need to catheterize this person. Aside from a fully formed natural one that doesn't have any scar tissue, because the stenosed urethra is also surrounded by scar tissue. I mean, it's a controversial thing, I guess even in intactism, but it seems that there's a small lip at the very tip of the urethra, and that gets worn away. I don't understand how it's not blatantly obvious with this idea that circumcision reduces UTI in the first year of life. Why would having your urethra, exposed to feces 3-4 times a day reduce your risk of UTI compared to having, intact baby who is, completely protected from it? Yeah. There's no way that study has any basis to it. It was done. The methodology used was deliberately manufactured to come up with that result. Yeah. And yeah.
Yeah, I like a lot of the studies that are done. If it's biased in the roots, then they'll try to form the methodology to come up with what they're wanting to come up with. One of the things that I think I keep hearing about that's questioned in that study that came up with that was, were they tracking whether the boys were being forcefully retracted when they were getting their diapers changed and everything like that? Because if they were being forcefully retracted, of course that increases the chances of UTIs in the first place. So yeah, intact, it's going to appear that the intact boys have a higher chance of UTIs if they're being forcefully retracted.
Absolutely. And no, that's something that, people don't consider. Forcible retraction is not on the radar yet. We're slowly putting it on the radar with parents who are, intact savvy and who are so protective of their kids. But even doctors are still so ignorant. From the ones I talk to, they still don't understand the basic anatomy. I don't understand why they would assume an infant should be retractable when they know one of the first steps of the procedure is to, use a probe and manually detach the synechia, the connecting membrane between the glands and the inner mucosal tissue. They're fused together by a natural superglue. Why would you be telling parents this is supposed to be retractable? You're deliberately deceiving parents. Especially when you see videos where they'll say, "Oh boy, he really needed a circumcision. She really had a tight foreskin." Every infant has a pinhole tight foreskin. That's normal. They all look essentially the same. There's not a whole lot of variability. They all extend slightly past the glands. It's a very tight, wrinkly area of, muscular tissue that's there for a reason. It's the rigid band that'll have its role later in life. And it also has its sensory role, I think, throughout life, just so your spatial perception of where the tip of your penis is and what it's in contact with. So it's doctors being educated on forcible retraction and basic anatomy is something we need to, as a community, focus on. I think we're doing a good job. I mentioned last time, it's the name of the organization, Next Level Intactivism, doing wonderful work. Yep.
Yep, reaching out to all that mass media, trying to get them to publicize this topic more.
In our events, having them, publicized, upcoming event, there's going to be this group of people in blood-stained pants standing at this corner, having a little media circus that gets our message out. I mean, that's the way to do it. Having the event is great, but if the media is not there,
yeah,
you've lost 99% of the impact.
Yeah, for sure. In fact, I met with Daniel just a few days, 2 days, 2 days after I met with you last time, and we had like a 3-hour conversation, 3.5-hour conversation, and I recorded it. It's up on the YouTube channel. So, yeah.
Yep. So impressed with the guy.
Yeah. I very much compare my feelings around this with his. We're both very angry that we were cut, and we're very, angry with people that are being willfully ignorant about the topic and all that. So, and we've both kind of given up our jobs, our careers, so we have more time to do this. So we're just, it's like me, I'm just doing Uber for the most part, and a little bit of light IT work here and there to pay the bills. And because I just can't handle the emotional stresses of a dedicated career job and that anymore, because I'm just too involved with this movement.
Yes. At the beginning, I mean, circumcision has caused stress throughout my life. Intactivism is both a way to relieve that stress. It also increases the stress a bit. There's nothing better than knowing that you just saved a baby.
Yeah.
I mean, that's the greatest thing. I think that, next level intactivism is a great place for the burnt out intactivists to go. Because you can go and do, like simple work, spreading emails, or, doing the tasks that Daniel needs you to do to spread the message. Me, I'm so burnt out right now. I'm dealing with, like my own things right now, trying to, that are, I would say 99% related to the stress of this issue, So for people out there, this causes such stress in people who are educated on it. And it's actually a burden on us emotionally when we do educate young guys, because we know that we are putting them down this path that will lead to things like depression, anxiety, maybe addiction, maybe in some cases we've seen suicides. Yeah. And people hear that and they say, a man committed suicide because of circumcision? What? Yeah. They can't believe that. And they'll try to immediately associate it with some other condition or something. No, when you learn about this, you'll go through stages of grief. And the same thing with the entire family. The parents who, were talked into it, give consent. Woe to the parents today who say yes with all this information out there. Yeah. The parents of 20-year-olds, they have an excuse. This wasn't out there. Today, there's really no excuse.
Yeah, it's going to get harder for the generations being born today to accept what their parents did to them. It's I think It's a lot easier for me being always born in the 70s. So yeah.
Exactly. And then now you're doing what you do. I mean, there's absolutely no way you could blame a parent like yourself for making the decision you made. You made a decision that was, universally seen in your community as this is the best thing for your child. Yeah. I know how hard it must be, having to go through it. I can't imagine, that, but, what you're doing is great,
Yeah, absolutely. Now you were talking about men committing suicide. I've done 2 interviews with people that have been closely related to men that have committed or have died by suicide over this issue. So go watch my other videos, people. if you're interested in seeing all this.
And the residual damage of, that to the family, or say to the man who becomes educated and is now unhappy.
Yeah.
That is something that is not mentioned to parents before the procedure is done. That there's a new phenomenon of men who are extremely unhappy later in life that they were circumcised. They're hearing this information, right now we don't know if it's true or not, we might consider this fringe, but it leads to XYZ, depression, anxiety. That's not mentioned.
Yeah.
That should be mentioned.
Yeah.
It's so obvious. I mean, and with, with even just, the way society is going, not mentioning that is criminal. And how hospital OB units operate with their techniques of, the high pressure cell techniques is criminal. If a parent says no one time,
That should be it.
that should be it. First of all, you shouldn't even be asking, can we perform cosmetic surgery on your healthy infant?
Yeah.
That alone should be grounds for you to, be reviewed, to have your license reviewed, what's going on with you here. But then
I wrote them recently about urologists in LA.
you do so much great work. I don't think people realize it, but you make a tremendous impact. Just the variety of things you do. I think it's great. And that's the way to do it, hitting these different, professional organizations with letters, things like that, like something I was talking about, continuing education course for nurses. That's something that needs to be done, and then there's, of course, nurse assistants. I've seen nurse assistants who have refused actually to retract and clean intact men. They're like, I'm not doing that, because they have this level of such disgust of, what they're going to find underneath it. It's insane. And, and this is, it's like, and these are elderly men. These are the men who actually are at that part of life where they will now require your help. Yeah. Oh my God, that's difficult. Yeah. Spiders and, things jumping out, you've been snake bit.
I should do a YouTube video on that. Just draw this down. Like,
that would be great. That would be wonderful. Pile of maggots fall out,
I'm gonna do that one now. That's great.
We're giving the pro circ community too many ideas right now. They're gonna start utilizing that. They're gonna find like the worst, most severe cases of whatever BXO or something like that. I actually saw once this horrific video of this doctor who was surgically forcibly separating this child. And the comments below are, oh my God, you parents, why don't you just circumcise your child to avoid all of this? No inkling that was completely unnecessary and criminally negligent what that doctor just did. But I mean, you really are. I mean, we're in the Stone Ages. American medicine on this subject is Afghanistan is to the modern world right now. That's really what it is. They're 600 years behind. It's sad.
Yeah. So much fun. So much fun chatting with you about all this.
Meatal stenosis still. I could do an entire show just on that.
Yeah.
If you're an intake parent, and you're going to have a child, just think about it. Do you want the primary contact point for your child's penis to be the tip of the head, the urethra, constantly being abraded with the dirty diapers and, the chemicals in diapers? Of course, that's going to cause irritation.
Yeah.
And if you sever the artery that feeds that area, you're going to have what's called hypoperfusion, inadequate blood flow. And if you have inadequate blood flow, you have inadequate healing. Okay. And that's why the stenosis starts to occur, because you have this buildup of scar tissue over and over again. Okay. And then to correct it, doctors then have to incise through scar tissue, which again will not be healing great and might readhere. The treatment for meatal stenosis is you have to have your 3-4-year-old child who's now conscious, awake, aware. He's going to have to go and he's going to be awake. First of all, they do this awake, and they have to actually use a scalpel.
I was 7 or 8 years old myself, so I very vividly remember. Yeah,
and how traumatic was that for you?
It was obviously traumatic enough for me to have a very vivid memory of it, but I don't remember feeling any pain or anything when the doctor took the scalpel to the.
Right, you were anesthetized. Yeah.
No, I don't know. Because it's scar tissue, right? And all that it was for me, he didn't open up my urethra, but I had a little skin bridge across my meatus.
Oh, okay.
Right, which made my urine go like this when I was urinating. So he just reached in there and just very, very carefully snip the skin bridge away. And again, it was scar tissue, so I had no nerves in it. So I don't remember feeling any kind of pain from it, but I do, it's having to have my grandmother take me because I was doing this, and having to drop my drawers in front of a doctor and having look really close to my penis and all that. That was its own trauma, right?
Yeah, and that shows the process. I mean, you had a bridge, in your urethra in the middle, essentially. That shows how the healing, the improper healing occurs.
Yeah.
And it leads us, back to if for parents who choose circumcision, again, they are not even given proper education on the post care, because as activists, we hear over and over again the stories of the parents who go for the 6-month well baby visit, and the child has developed a skin bridge where the wound has adhered to the glands. And the doctor.
That was the next topic. Just so people know, skin bridges are like when the inner mucosa tries to reconnect to the glands up here, because it's supposed to be connected. So the body is reacting and creating scar tissue up there. So
yes, and I would say Google images of that. And while you do that, note that's an adult man, you're saying, who has a skin bridge, and he has still decided not to go and have that surgically repaired. He said, you know what, I'd rather keep things the way they are than have somebody cut into my penis, even to repair, something that is like, truly that is, an abnormality. It's a complication. They still have decided for whatever reason not to have that done.
Yeah.
I mean, correcting that, it's not the biggest thing in the world, but it's something that occurs. And the trauma, what occurs with the infant when they have to forcibly separate it, is extremely painful. The stories are always the same. The infant immediately begins howling in pain and then has another several days of recovery from that. Yeah. And that's another whole trauma that you've put this infant through that's going to be, programmed into this child's brain as it's developing at this young age.
So just for the people that are like, oh, my baby didn't cry or my baby didn't scream or whatever. Well, one of two possibilities here, probably. One is you weren't in the room and the nurse came out and just lied to you. That's one possibility. Or two, if it's done shortly after labor and the mother was like drugged, given meds or whatever during the labor, those transfer into the baby, right? So then the baby is like kind of already out of it before they're getting cut. So it's almost like they're put under, but without being put under. So,
Right.
yeah.
Or, another possibility is, when they were, if they were doing, say, like any kind of dorsal block or whatever, or they happened to bag the nerve, and they'll say, what's bagging the nerve? Because the needle went through the nerve and destroyed it, So if your baby didn't cry, oh, well, maybe that's the reason, you'll find out later about that one, and of course that's a catastrophic, injury, they'll talk about damage to, more, anterior nerves, as you know.
And that baby might grow up to be a man and never know that he had his nerve bagged, as you put it, because he never knew any different.
Right, he never knew any different. There's so much, I saw a video, and it was so disturbing. It was a couple about to be married, and the man suffered from premature ejaculation, and it was a show done in a foreign country, luckily. So the announcers were very kind of more neutral, and they actually did not only a circumcision but a neurotomy on the man's penis. So the nerves will come out, from the base, and there's the main nerves, and then there's branches that branch off, and the doctor would like twist off every other branch. Yeah. And I mean, it's like horrifying. And even the announcer says this, this could cause problems lifelong. And then they did the circumcision on top of that. And I mean, it's just horrifying the amount of damage they're willing to do to cure what they will consider, okay, this is your premature ejaculation. This is an issue. And it's sure some men might find that to be an issue for them. But saying that this is your cure, you might be very unhappy with the results, very unhappy. We've seen men after they've been circumcised and, the results of how they feel about it.
Yeah.
So
as a nurse, how many times have you seen skin bridges?
I haven't seen a whole great deal of skin bridges. In my career, a few hundred. That
still seems like a freaking lot.
It does. I've seen a lot of penises, but but also a lot of these people are, a lot of my career has been spent with elderly folks, so they might have been corrected when they were younger also. So it could have been more, but the degree. And mostly, I think, a lot of the skin bridges are dealt with at a young age. So, if the doctor's at all, at all competent, they'll correct it.
What's the percentage of corrections? I forget. I don't know if I've even seen
for meatal stenosis.
For circumcision corrections. Right.
Oh, well, I think that'd be a great study too. Let's call a pediatric urologist here in America, and then let's call one in Germany and say, how do you spend most of your day? What are you doing?
We've had some urologists in the movement speak up and say, yeah, a percentage of my work is, very much working with these babies that got messed up by the pediatrician or OB or whatever, and having to fix what they screwed up. It happens a lot, according to these urologists. So.
We'll hear it all the time, and unfortunately, even these urologists, when you say, well, what was the problem? Oh, too much. Foreskin was left behind. So too much healthy, normal, erogenous tissue was left behind. For the parents, the parent was not happy with the cosmetic appearance of this baby. So they already put the baby through this one horribly traumatic procedure, but they're still so concerned about this cosmetic appearance. They want it to look different. They'll put the kid through under general anesthesia. So let's talk first about what is general anesthesia. we're going to give your child inhaled gases, knock them unconscious, and IV medications to, stop the neurotransmitter transmission through the brain. And, we know what the rates of complication for anesthesia are. We know that people die from anesthesia. There's things called like malignant hyperthermia, where people will have fatal reactions to anesthesia or just not come out of it the same. When that happens, you don't know about it, so you're going to put a child under general anesthesia to correct non-issue, another cosmetic non-issue. And that's the level of, I would just say, criminality that we deal with still in this country, and frankly, around the world, even in, much lower numbers in Europe, you could still find centers where they'll mutilate your child for you, and they don't have laws to protect these children. It's still too much political pressure, as we recently have seen, to get any kind of laws passed to protect boys. It's far and few between. Luckily, the societies are educated enough where they know not to do it.
Yeah.
And I've spoken with Europeans who don't even know circumcision exists. They're like, what's circumcision?
Yeah.
That's something the Jewish people do with the penis. They don't even know what it is.
Yeah.
And then when, they're educated, they're absolutely horrified,
Yeah. I posted a tweet because I heard this story from someone that went to Japan. And in Japan, they went to this daycare and they talked about, dealing with the intact penis to the people at the daycare. And like, what is a not intact penis, or what is this? What they were like completely horrified to hear that this was going on in the world.
Right. It's like there's nothing. They don't think there's anything to do there. You know what I mean? It's just a baby. What do? You just clean it. Thinking that there's some horribly complicated process for an infant's penis. You'd be like thinking like you have to you have your infant's fingernail. You have to get underneath it every time, and try to get as deep as you can because there might be dirt there that could cause an infection. And it's the level of stupidity here that's been ingrained in us. For us, it's more than mind-boggling. It can make you question reality. Like, are we living in the Matrix here? Are people actually this stupid and gullible?
Exactly.
But it's fair. It gives you a very good insight into humanity and how horrible things can happen. People will do terrible things if everybody else is on board.
Yeah. The next section is about erectile dysfunction. Now, I think erectile dysfunction occurs for one of two main reasons. One is something's going on up here that's kind of keeping you from getting excited. And then the other is lack of sensitivity, down there, right? If you're missing, a large percentage of your sensitive tissue, and then when you touch there, you're less likely to get a serious, hard-on, serious erection.
Right. There's a large number of reasons. If you were to make a chart, you could make a huge number of causes. Besides circumcision, for people out there, SSRIs cause erectile dysfunction, and they'll cause numbing of the sexual nerve. Sometimes that can be permanent. That's something that doctors don't talk to their patients about. So, beware if you're considering that can be a complication that you will endure if you use SSRIs to treat your depression, which is, of course, I think, treating depression is it can be an extremely serious condition. So, do whatever your doctor says, and that just be aware that can be a complication. But of course, if you're lacking, the normal nervous system of your penis, and you're not having the normal impulses that tell your penis stay hard.
Yeah.
It's like it's so obvious. Of course, you're going to have, higher levels of erectile dysfunction if your penis feels nothing. If you have very little intermucosal tissue, which is where much of the sensitive, the Meissner's corpuscles, the types of nerves that give you that, the erotic pleasure, the sexual pleasure. I wish there was a great kind of, term to explain that. And, the different types of nerves and innervations, but you're destroying the nervous system and you're destroying all the impulses, the biofeedback mechanisms. And so, yes, you're going to have men who can't stay hard. And it's, say again, look in the porn industry, you know what I mean? I mean, intact men, or circumcised men rather, I have a harder time staying erect. You can notice it if you watch videos when they make cuts and such things. But it's there should be a great study done on that. That's not done. That's not some, biased piece of crap.
Yeah.
But in my opinion and experience, there's no doubt that circumcised men have a massively higher rate of erectile dysfunction compared to intact men,
Oh.
And same thing with the strength of their erection, their duration. And not only that, but the entire orgasmic process, I think, is totally changed. I think if you were to graph it out, with, the different contractions and everything that it would be obvious immediately that circumcision alters orgasm, alters ejaculation, its strength, consistency, of the ejaculate for different reasons, because of the contractions for different areas where the fluids come from. So there's so many studies that could be done that would prove our case, but since they're not done, I'd just say watch porn.
Yeah.
Just watch some intact porn, watch the man ejaculate, say, oh, wow, it's much different than anything I've ever seen if you've only been with intact men.
Yeah.
Now it might not be every time. You have to kind of be knowledgeable. If you have a circumcised man who still has a great deal of his inner foreskin left and his frenulum remaining, then he might function very well still. That's what you're looking for. If you have a man who has almost none, then you'll see a difference.
Yeah, exactly. There's not one kind of circumcision or one way of preputially amputating, right? So,
no, you could have men, where essentially almost the entire shaft is intermucosal tissue. It would be a man who decided to be circumcised as an adult and decided to keep all of the erogenous tissue. And I've actually seen, men who've requested that, and the doctors won't perform that type of procedure unless they get a written letter from the patient stating that this is what they want. And the doctor responds, if you have this type of circumcision done, you may have an increased risk of HIV or, all of these awful problems that could possibly occur, Yeah.
There, Doc, there's my dotted line. So you can cut right there and there. Okay. Thank you very much.
So sadly, I've seen a picture of that. It was a guy who drew a line. He was going to be circumcised and said, "Do not cut off the entire knob, please."
Yeah.
But how I think intact men who are circumcised, and we see in these studies, they are typically all suffering from phimosis of some degree. They're not, they don't have normal penises because they were damaged as children. Forcible retraction, I think, will also damage the frenulum. It will, cause damage, of course, to the glands if you continually are tearing off, the top layer of the glands where the nerve endings are.
I was actually going to mention this earlier because I interviewed Alex from Australia, who got cut at I think 19 years old, and he still has about half coverage on his glands, but he was told he went in for different issues, But when they were looking at his penis, like, well, you're not retracting. Why not? That's a problem, right? And so he was convinced that that was a problem. That he had a form of phimosis. It was the form where the Darwin's fascia was too tight, so it wasn't like spreading out and allowing it to come fully down onto the thing. And he wasn't given any other options for what else to do with it. They just said circumcision. It's like they didn't say, well, you could do these creams, you could do stretching, all this other stuff, or you could even do just a dorsal slit. They didn't offer any other options. So,
right. I would say to anybody who has any kind of phimosis, there's 100% chance you can be cured without any type of surgery. Okay, even without some steroid cream. Steroid cream can be of help, but you can stretch. Okay, yeah. You can stretch, and you can create a little device yourself. A little dilator.
Yeah, if we get stretched to restore our foreskins, certainly you can stretch to fix phimosis.
Of course. I mean, if we want to, we could have P.T. Barnum come out with some guy who could stick apples inside of his foreskin because he decided to stretch it as much. I mean, you could stretch your foreskin as much as you possibly wanted. You know what I mean? You could stretch it so you could wrap it around your arm.
Actually saw a guy. I saw a video of this guy. He took a pencil and put his foreskin around and wrapped it around it several times. That was kind of disgusting, but. Okay.
Yeah, no, I mean, it proves the point. For parents who are told, they'll go to the doctor with the kid who's 6, and who thinks that this is a problem. Okay, first of all, you've been lied to. It's not a problem. Okay, even if the kid's 12, he give them another few years and see what happens. When it becomes a problem, it becomes a problem when the kid says, this is a little bit of a problem. Then you go to the doctor, and then you can try creams and some stretching. Or not even go to the doctor. I would say first start stretching yourself.
Hold on. So if a kid says, well, I feel pain here when he has erections, think about that. Does the kid even understand what's going on? I mean, he might feel some stretching going on there with his skin or whatever. Is he considering that pain? Or is that just normal process of him getting an erection and things haven't all stretched out yet? Oh my gosh. It's like, come on, he's just a little kid. He doesn't even really know what he's talking about when he says pain, Well,
I mean,
is he crying?
Yeah, I mean, basic development, should be, first of all, the first class in nursing, about, or in medicine about, penis. How does it develop? Yes, it is connected by a membrane. Yes, that membrane will start separating over, a finished study, I believe, said the average age is 10.4. At the age of 10, most boys will be able to be retractable. Yeah. But that, it's not an issue if they're not, you know what I mean? But also know that as your child gets older, grows up, at any point, they might have a day or two where they become a little reddened and swollen and cry because they've had a little separation occur. Mm-hmm. And then when they urinate, there's going to be a little ballooning. Yeah. And that, if you're not educated on it, that will look like, oh my God, what's going on? Yeah. And they'll run to the doctor, and the doctor who is, I've seen, even British doctors who will say, oh, there's ballooning, and they'll diagnose that as a problem. And, and recommend stupid things. But if you have an infant, that will occur when separation occurs. You will have, there will be possibly a day of a little bit of discomfort, maybe a little bit of redness, but that was the separation. It's usually just a one-time thing. It's just the separation of the membrane. And then when your child urinates, there's going to be some ballooning. The foreskin will balloon up and urine will come out. As long as urine's coming out, there's absolutely no problem whatsoever. There's no danger to it, and it's functional. It cleans the inside pocket, the new area that's open. Yeah. So it keeps everything I tell the people, it keeps it squeaky clean, and it aids in further separation of the rest of the adhered foreskin. Yeah. So that's how
ballooning comes up all the time in groups on Facebook on how to care for your intact boy and stuff like that.
Yeah, and it's a reason boys get circumcised by scared parents. So it really needs to, I always emphasize when I educate parents, this is going to happen, even though it doesn't happen in every case. I'll tell them it's going to happen, and I also tell them that, the preputial sphincter, might not relax until the boy starts reaching puberty, and tell them the hormones will start to make things relax. Because then, I tell them, there's a purpose. Foreskin has purpose. It's got a purpose in childhood of protection, and then adulthood protection in sexual function. Yeah. So then they understand it,
So for those people that don't know what preputial sphincter is, okay, you got your prepuce here, right? And at the end of you have the dartos fascia that is making the prepuce squeeze around at the end of the penis, and it's creating a one-way valve for things to get out but not go in. So that's squeezing, and that's where the urine is going to be allowed out.
Yep. And for parents who are attempting to forcibly retract an infant, if you do retract that infant, you're going to possibly cause, like what I mentioned earlier, paraphimosis, where the foreskin is now stuck behind the glands, and you've now created an actual emergency where you're now, constricting blood flow, and you need to now, either, you need to either deflate the glands and, forcibly get it back over by a medical professional, or, you could do it yourself, or they might need something like at the worst, a dorsal slit.
Yeah.
A dorsal slit.
That makes me think. So you said deflate the gland. So if you're having the prepuce is down below the ridge here, and it's squeezing on the penis, is that like making blood go up and not being able to escape out of the glands area, and that's why maybe the glands are getting bigger?
Exactly. Yeah. Okay. It's kind of like a blood pressure cuff almost, Yeah. I mean, it's the pressure, it depends. That'd be an interesting thing to to see, to do a Doppler on. I'm not sure about that. I'm sure Dopplers have been done to see, but no, I mean, but correcting it, it's like I said, it never requires circumcision. If you go to a hospital with an infant or a young boy with that problem in the United States, you're going to be told they need to be circumcised, I would say, bar none, 99% of the time. That's what you're going to be advised. Okay, you're going to be told your kid has this problem with the tight foreskin. He needs to be circumcised. Otherwise, all these horrible things will happen. No, actually, all you need to do is get the foreskin back over. The very worst, you allow happen is a dorsal slit, where when it's back on the top, all right, they will, on the dorsum, they'll make a little slit behind the glands where that tight phimotic ring is. They'll release the phimotic ring, and that's unfortunate damage that you're doing to your kid by doing that. Truly, and who knows what what effects that will have. But you're saving the kid's foreskin, and he can do whatever he wants when he's older and get it repaired. But that will cure the problem. Okay, you can resolve a paraphimosis emergency, which is incredibly rare. Like I said, I saw one case in my entire career since 2004, and it was it was fixed with just a little deflation pressure. So it's not something you're going to see. If you're a nurse, if you're thinking about going to nursing school, if you work in the ER like I did for some years, you might see a case, be interesting if you ever see a case, but hey, I actually saw a case of this, it was amazing. The other thing that you don't ever see, at least in my experience, I've never seen a person who had a case of penile cancer. I've never seen like an elderly adult man without a penis who suffered a case of penile cancer. I've never seen it. I mean,
it's a 1 in 1,000 chance, lifetime chance of getting.
I think it's 1 in 100,000 or 200,000.
No, I hear it's 1 in 100,000 that occur per year, and it's 1 in 1,000 lifetime chance for the man to ever get it.
I'll send you a letter I have from the it was sent to the AAP from the American Cancer Society. You've seen that letter?
Yeah, I have.
And I've seen different studies I have numbered, but I mean, it's just something you don't see. You don't see penile cancer.
Yep.
It's not,
Yeah,
and
it's extremely rare.
It's extremely rare. And, in my study of it, it seems to be equally among circumcised and uncircumcised men. I've seen cases, the penile cancer is down on the lower shaft skin, and then they repair through, different types of grafting and stuff. So it's not always a cancer on the glands or on the foreskin or inner foreskin. It could occur anywhere. If it's true that there is a higher rate of it, I question that. But if it is true, it's such a minuscule amount. There is absolutely no reason to touch your infant for it. The 18-year-old boy or man, he can, hear that statistic and then decide, hey, I think I want to have 80% of my penile skin amputated. So, I don't have this 1 in, 1,000 chance of,
some women choose to get mastectomies because they have a high risk of getting breast cancer. But that's their choice as an adult. So it should be our choice as adult men, whether we want to have part of our penis removed or even all of it, preemptively.
Yeah, it's the question, would any doctor preemptively amputate, the breast buds of an underage girl who, without her consent has, knows will have a 50% chance of lifetime breast cancer or even breast cancer by the age of 30 or 40. No, I don't think you would find any doctor who would be willing to do that. They would consider that, without her consent,
Well, there is one doctor that Chris Elko, Reed Nelson, and I protested. There was another guy that joined us. But anyways, we all protested him in Seattle. He works at Seattle Children's Hospital. Douglas Diekema. He is, and he's a speaker. He was a speaker at a bioethics conference in downtown Seattle here where we were protesting. And he's made recommendations for cutting out all sorts of body parts of girls or of a girl or whatever that was like not going to be capable of caring for themselves as adults. So, cut off all this other stuff so they don't have to worry about caring for that stuff. So
you're right. Yeah, that's great. Yeah, it's so much easier not to wash your arm when you don't have the arm,
Yeah. So, there are doctors out there that will go that far, and even doctors that are considered bioethicist leaders. It blows my mind, this guy, Douglas Diekema. So
I think Diekema hired his own security staff. Is that correct?
Well, he actually walked up to Reed and I and Chris and looked at our signs and looked at us for a while. He didn't say a word, but we knew who he was, and he knew that we knew who he was. Both Reed and I sent them letters saying, "Hey, we're going to be here, just so you know." So I guess he wasn't afraid of us because he knew that we were going to be there already. He came with no one to protect him or nothing.
It might not be Diekema, but there is one of the AAP members who was on the.
Yeah, I think.
Who was so scared of us dangerous intactivists.
I'm pretty sure that was Diekema too, because Brendan Marotta.
It was. Okay. All right. Yes. Yeah. So.
And Brother K pursued him one time going into a building.
Yeah. Yep. If you look at the history of how they come up with these position statements, it's a wonderful thing to look into to see, how people will resign and how they'll have to get different people to rewrite ethical opinions on it and changes and the things they'll change throughout the years, and you see how they're hoodwinking you. They're selling you snake oil through these different techniques. And if you're aware of what they're trying to do, it's completely obvious. They're trying to trick you, lie to you, and hide information from you. Because it's about money and it's about keeping insurance coverage.
Well, and avoiding liability.
And avoiding liability.
Right.
Yeah. And
Yes.
keeping, and I think and keeping the general population as ignorant as possible, because I think some grown men might be extremely pissed off. Yeah, there you go.
As long as these medical professionals have guys boards like this behind them, then they're less likely to have to face liability, right?
Right. And you don't want a country of men who are outraged that you mutilated their penis, because then you all might need personal security. I mean, I would tell the doctors in the future, I mean, this is going to become a man who might become extremely mad in the future. Now, the great thing with intactivism is, I mean, I've never heard of any violence from any intactivist, because our case is made verbally. We have such a strong argument, and we can debate so effectively, we can always, just resort to using our brains and educating people and going on social media. I fear if there's like somebody who's, who just learns about this and is extremely violent, if something like that were to occur, then the pro-circumcision people would try to paint an entire movement as, all these dangerous fringe, people. But yeah,
I don't think that would. I mean, that could go either way, though. It would still raise awareness of this issue more. So
it would raise awareness for sure.
Yeah, even if you look at 911, there were a lot of people that started asking, well, what is the U.S. doing that's pissing these people off in the first place, right? So that event, as horrific as it was, it still raised awareness of how the people in the Middle East and how how large groups of people think about the United States. It raised awareness. So if something like that happened, as horrific as that would be, it would hit the mainstream news, and that would raise more awareness of this issue.
Yes, it would. Yes, it would be a major story, and it would bring it to the top of the news cycle for a while, get people talking.
So my recommendation to the mainstream media is, hey, start getting this out now.
Yeah, absolutely.
So it doesn't have to get to that level.
Yeah, I mean, with Megan Kelly's interview.
Fox News.
Yeah, I forget her guest, but it was during one of the San Francisco, petitions and the foreskin man issue. Yep. And he was describing basically just like a portion of how the separation occurs, and that was even too much for her to hear. She had to like end the interview right there. She's like, "You've just made all the men in this room cringe."
Okay, man.
There you go. I advise people look at all the different versions of it.
Yeah.
And how many of them seem to be anti-Semitic to you? No, they're talking about people who are circumcised.
That's only one page.
There's one page
that addresses the Jewish side of it, and then all the others talk about all the other genital cutting that goes on. And of course, it's it's a comic, so it's dramatized. And I gather that the mainstream media painted it out as being anti-Semitic and all, but it's a comic, so it's going to be dramatized some, but it's also based on what's really going on in the world, and it's educational in that way. So it's a kind of a fun way to get educated.
It raised some awareness, but you see how the media spun it as just that one page. Being anti-Semitic, and that's unfortunate. That was a while ago. I was very disappointed in Megan Kelly because of that. I enjoyed her interview with Luis Elizondo recently, though. But so yes, I do think that would be definitely a two-sided coin, but I fear for that in the future. As these young men become educated with social media, they're going to be very upset.
Yeah, I've been chatting. I recently did another interview. I just recently made it public. It's where is it here? Why am I not seeing it right offhand? He's a Canadian, and he is suing. Oh, maybe I'm on the wrong page on my 130 videos. A guy in Canada, he is taking legal action. It's practically the equivalent of the Medical Board of California, but he's taking action against the board that's up there in Canada to try to get them to, address this issue. And he's kind of sort of suing because he's mad that he's hurt. And but just like California Medical Board, they're claiming standard of care. So he keeps attacking. He's attacking that in a very. His dad is a lawyer, so he's learned a lot from his dad. It's very clear that this is rubbed off on this guy. So he's been writing tons of legalese back to them saying, okay, how is this standard of care? How does it meet the standard of care? Because I don't think they have a solid answer. These guys don't have a solid answer. The first time I wrote to them, I was like saying, well, this is not legal. And they're like, yeah, it is. Well, that's all they said. They didn't explain how it's legal. They just said, oh, it's legal. Where in the legislator, law books out there is it legal? It's nowhere written. Hello.
They should have the doctors opposing circumcision, write some letters to the court too. I'm using the legal term, like a letter from a friend of the court. I forget the legal term. But yeah, I mean, there's so much information that can, really debunk this whole standard of care myth.
I have fairly frequent conversations with John Geisinger and Jillian Longley, people that are. And I actually even did an interview with Christine, Dr. Christine. Oh, I'm going to blank on her name right now. Christian Northrup. You can find my interview with her. Also, a doctor involved with doctors opposing circumcision, and a regret doctor who used to do them. But I chat with them about what else can we do? What else can they do? Sign their name on to things to try to talk these people into some sense and all that. But yeah, it's challenging and complex, and there's a lot of history behind what they have done in the past and all. So.
Yes. And reading the history of genital cutting by American medicine and how it continues today is it's such a dark chapter, and the fact that it continues is just so sad. But it's dying,
Yeah,
it's dying.
It's gonna come down to popular opinion. I think is gonna be the main thing that is the key in changing, getting these people to admit or accept, changing things. So
yeah, and I think the big hurdle is getting over this basic disgust mechanism when they see an image of an intact penis and this spiders popping out fear. That's the main thing. Having to have intact men say this is not an issue. It's not hard to clean. It's actually fun to clean. I like cleaning. Cleaning. It seems like 300 times when I'm in the shower. This is not something I don't. I avoid washing these. Can't figure it out. I mean.
That claim just blows my mind. It's like, who the hell?
Boys won't touch their penis in the shower.
Probably maybe because they've been told that they shouldn't be or whatever, but
or they can't figure it out, or or the horrible thing of parents saying, you need to have a Q-tip and be trying. It's just, I mean, even some fairly educated people, hear them saying, new intactivists would be saying, oh yeah, they tell me I have to try to go in and clean out any, if there's any smegma coming out or whatever. Like, no, it'll come out by itself and the baby will urinate and everything. It's self-cleaning. I always use the self-cleaning metaphor. A vagina is self-cleaning. Yeah, your child's intact penis is self-cleaning as possible.
Yeah,
as anything can be.
All right, so the next thing was about premature ejaculation. We've been chatting about that quite a bit lately, but one of the things I kind of came up with one time. And this is for men that still have their frenulum area, like me. That I think that premature ejaculation could actually be higher for the circumcised guy if he still has, that inner mucosa and that frenular area. That's definitely a hot area. If that's exposed when sex starts and that gets touched right away, then yeah, that might be enough to set a guy off to ejaculate
Exactly.
before he even gets started. I even saw one porn video where the guy ejaculated before he even started having intercourse because he got too excited. I think she touched him just right or whatever, and he ejaculated. But if you have the prep use in place, well, hello, where's that frenulum? It's in there. It's not even being activated yet. It's not exposed to get activated. So
it's not under any tension whatsoever.
Yeah.
It's not, right, exactly.
So
and there's no biofeedback either. The biofeedback mechanism of the other nerves being, the other nerve impulses coming through the nerves going to the brain is involved with the two, I believe.
Yeah.
I mean, this is my own hypothesis. I cannot prove this.
Yeah.
But there's biofeedback involved. And of course, anytime, if you stimulate the area or put pressure on it, tugging, that's what stimulates that area. And I agree with you. That can absolutely be a cause of premature ejaculation. And then seeing the cure they offer to completely amputate your entire frenulum and all inner mucosal and just leave you with shaft tissue and the glands, it's horrific. And then saying, oh, look, it takes you 4 times longer to reach an orgasm, if you can, at your age, and of course, if it doesn't happen, I'm sure they blame it on something else. And, it's just truly horrific when you look at what they do and, how they continue to try to, I think they're going to start changing their techniques a little bit. They'll say, okay, we'll start to try to, preserve the frenulum now because maybe it has a role in meatal stenosis and maybe sexual pleasure. So, I've seen there are doctors who will perform, frenular sparing circumcisions and intermucosal sparing, so there's doctors now who are coming out with, ads, will perform this type of circumcision that has, we believe, less risk of affecting your sex life. Yeah. I don't know. To me, I say, well, okay, good. At least you're getting the message out that circumcision is damaging.
Exactly.
You're helping.
Yeah, absolutely. Keep raising that awareness. Then the last thing I've got on the list under physical harms is general botches, and I don't think that I have any what you might consider general botches. I don't have any curvature of the penis, to the left or right during an erection. I often refer to anyone that's like an engineer type or someone that does building or whatever. You know how to deal with a 90-degree angle, right? When you're cutting this, you need to try to have that 90-degree angle mindset, because if you cut this at an angle one way or the other, then what happens when you have an erection is you have too little skin on one side or the other, and that's makes the penis to curve a little bit. And you can find penises like this in porn. It doesn't take too long to find them. So that's one kind of botch, right?
Yeah, I think there should be some type of interactive computerized video for parents where they can see I actually have on my phone, I have every different type of circumcision for when men with entire just intermucosal shaft to men with none. And when I use it, I'll educate and trick people, and expose their own ignorance to them and say, well, so you understand in your experience, this is the sensitive area. So does this man have more sensitivity than yours? And they'll be like, oh yeah, that makes sense, and then you could show them men who have none. And then they're like, oh my God, that's terrible. That guy does not have what my husband has. And so then they start to understand what we're talking about. And that what we're saying makes sense. And then you can start to broach into the other issues of these ridiculous medical claims that they try to come up with of, reducing, your tonsillitis at the age of 60 by 2%, blah, 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 joking, of course. But as far as botches, I hate even, using the term with circumcision. I mean, anytime you're amputating healthy, normal, erogenous tissue from a non-consenting person, you're botching,
Yep.
you're damaging, you're causing damage, you're causing an open wound, you're throwing away healthy, normal, functional tissue.
Yep.
And, and what people, like I mentioned earlier, what people consider a botch, is usually leaving too much behind. For the people who've had what we would, consider like, what we were talking about before, the men who've had, the premature ejaculation, corrective surgeries where all the intermucosal tissue is removed. I mean, that's as botched as you can get. I mean, if you consider a penis to simply be glands, then okay, then that's a penis to you. But no, the image of the cell phone and then the size of the prepuce that's removed from the adult man compared to each other, how they're the same size, the index card, sometimes I think it's a little larger, and the erogenous tissue area that's removed. That's why I say if there would be a great interactive like little computer program where people could scroll around and see different kinds of circumcisions and the development, it would be great. It would be a great kind of educational tool. I wish I had the skills
That gave me an idea. I've been working on the Catholics Against Circumcision site. I'm doing a refresh for it, putting it on WordPress, and one of the things I'm doing with it, here I can pop it up here real quick. The new one is I'm doing a slider for the homepage. So when you first get to the site, you see an image of one or the other slides, and so it's like a picture, and then it has some text on it, like this one says Catholics have no religious requirement for circumcision, and then it slides over and it gives most Catholics worldwide do not circumcise their children. And you can click on the arrows left or right to kind of scroll through these images. Right now I only have 2 slides. So Tim Hammond, he has the circumcisionharm.org website. I'm kind of wondering if maybe we could take some of the images that he has and create a slider page somewhere for people to scroll through.
I'll see if I could share my database too. Yeah. And another funny area I will use to educate is on and I hate to do it, and I have some ethical reservations about, but these online these online interactive porn sites. So there'll be like a porn actor, and then a group of chat men. And then you could start, texting, oh, that's that dildo is an intact dildo. And then you can raise awareness through that and start the conversation with them, the actual model about the topic there. Yeah. And that's a very, I think, unique way to do interactivism. And I've done it before, and I've recorded some very funny exchanges. Especially there'll be, you could find different topics like pregnant. So you'll go to the pregnant, women, and then you can start educating them, because now you have, an entire group of pregnant women who you can educate on this topic. Yeah. And it's a different avenue that I haven't seen others use before, but it's effective because you get this conversation going, and all these people listening who are not actually leaving the conversation.
Yeah. They're not disgusted by porn or whatever. I've actually seen some videos where they've done interviews of various porn actors, porn stars, whatever you want to call them, where they would talk about, circumcised or not, and pros and cons and stuff like that. So.
Yeah. And you'll get the, the model, they'll be like, oh yeah, I agree with you. That's terrible. And, you can talk with them and, get a discussion going. And, if they're very receptive, yeah, in my experience, it's an effective way to, to activate, and educate people. And religion too. I mean, didn't really talk about religion, but yeah, I mean, for anybody, of the Catholic, faith, or, I mean, yeah, you need to really look at your New Testament. If you believe in that, yeah, I mean, there's, every reason in the world. I like to say Jesus was the first intactivist. He truly was. He truly just seemed to despise the surgeries, according to the apostles. He died to end it. He called the people who did it dirty dogs and evil men.
No, you're talking about the Apostle Paul.
Apostle Paul, yeah.
Yeah, he has a lot to say, particularly in Galatians, about that. So, yeah. So, yeah, lowlimages.org or Catholics Against Circumcision, whichever one,
Your little limit, yep.
Yeah. If religion is something that you really lean on for making this decision, it wasn't a decision. It's not at all a driver for me at all, because I believe in religious freedom, and I pass that religious freedom on to my own children. I give them religious freedom. So,
something else would be a good idea to talk about. I was thinking of a great intactivist, Franny Max. I don't know if you know Franny.
Oh, I know her very well.
Yeah, and I used to help her, and I'll go on and help educate about kids who are born who are having hypospadias. And that's when we talked a little bit about it at the first interview, where the urethra is not at the tip of the penis, but it's open lower. And doctors will always, say, oh, we want to repair this surgically, and we want to use the foreskin as this graft material. I consider any type of surgery to correct that. It's equally genital mutilation. It's completely unnecessary. It is so harmful, and it has such devastating effects. You don't see guys who say, oh yeah, I had this and I'm fine. I have a normal sex life. Things are functional. Yeah. What you'll see is, oh yeah, my parents had me. They attempted to repair this in infancy, and now I'm on my 15th repair, and learning about that is critical if you find out your child has any type of defect, because there's if you go online, you'll either be drawn to the pro-surgical site or Franny site, and it's talking about, hypospadias, epispadias, and, hopefully they're drawn to Franny site, or, they'll research both, because hypospadias repair is just a disaster.
This is the only one I have book-wise on intersex. I
haven't
seen a whole lot of there's a lot of YouTube videos though, and TEDx talks on intersex, and there's plenty of boards you can groups you can join on, like Facebook and stuff like that, and they talk about it. But,
there needs to be just a total universal ban on any kind of sexual surgery on children for any reason, unless there's some catastrophic reason why it actually needs to be done. But I can't think of what that would be, off the top of my head. Because just so much stuff exists, and it's all still rooted in the past and in bullcrap, and like hypospadias, like a subglandular, oh, the child will splatter when they urinate. That's cosmetic. Okay. That's something.
You can sit down like girls do.
You could sit down. Yeah. Or now you could, when you're an adult, you could figure out how to not make it splatter, or, there's just so many ways. That is cosmetic. Parents do it because they feel the child is not normal. Yeah. Getting parents to realize your kid is perfect, your kid's beautiful, they're born as, their penises as undamaged as it is ever going to be right now. If you go down this path of trying to correct a tiny hole by making a huge incision and then taking graft material and then hoping the graft material gets blood flow and doesn't rot off. I mean, I've seen so many cases, and, you read the notes and, oh, the graft is necrotizing, and, for further procedures are going to be needed in the future. We'll reevaluate in 6 months, or, patient, does not wish catheter to be removed at this time. I mean, there's just, it's just the men who have had this done, they call themselves hypospadias cripples.
Yeah.
And they are sexually non-functional. So if you try to, correct your child's small congenital defect with this, don't expect to have, a kid who has a sex life, or maybe grandchildren, or don't expect to even ever find out, because they probably won't ever mention to you that they have a problem, because I don't think 99% of guys would say a thing to anybody about it. It would just be their secret for their life. They would die without having children, and that's it.
Yeah.
Yeah.
Yeah, and I applaud those activists out there that are trying to educate parents to avoid doing these kind of surgeries, and they're involved in like Your Whole Baby and stuff like that. There's even like a flyer that's handed out at Your Whole Baby tables at events, stuff like that, about this topic. So
Yeah.
And I know I've heard that Lurie's Children's Hospital, I think it's Boston's too. They've apologized to the intersex community for doing these surgeries before they really needed to be, and that they should have just waited until the individual was old enough to, have a hand in getting that surgery.
Yeah. I'd like to throw a shout out to, Lauren Meyer. She's an intactivist up here in my area, up in the northeast of the United States. And she's a regret mother. And, she has herself, holding a sign, "I'm a regret mother," on the back of, the billboard truck, if you've seen that. And it's just such a brave, great thing to do. The topic of regret parents, I think it's another topic you could do an entire show on.
The Intaction, intaction.org billboard truck.
Yes, yeah. Yes. I think that's the one. Yes. There are two different ones. There's the one, there's I think two, but there's the one that have the men saying, I regret being circumcised, or I am a regret parent.
I did not consent.
I did not consent. Yeah. And then there's the one with the regret parents, and and Lauren being on that billboard was it was one of the first things that I saw, and I thought, this is so great. That's such a brave thing to do. And she's a great activist. So I wanted to give her a shout out, and I hope I see her soon. I hope I see a bunch of our friends in Philly soon. The AAP.
Yeah. Hi. So we were talking about general botches. There's a whole bunch of them. I'm not going to spend too much time here listing them. People can go to circumcisionharm.org to see a whole bunch of them. You can also buy a book from Dr. Fahmy, Fahmy. He's a urologist in Egypt. He joins the bodyguards meetings fairly regular basis. But yeah, there's plenty of places out there to find or see all the different kinds of botches that occur. So, and they do occur more often than people.
And children who are born with just on the spectrum of difference, like if they're born with like buried penis, and the doctors will then try to recommend a circumcision. It's like it's actually contraindicated in that condition. You'll have doctors, contraindication means if you have this condition, you never do this.
Yeah.
But in that they're recommending that, and so they are going against their own standard of care. I mean, if they do that, you could sue them.
Yeah.
It's just, it's just circumcision is all they know. They think every infant should be circumcised. And in the NICU, it's the worst horror show you could ever see.
Yeah.
Okay. In my experience, just to tell you some things about what I've heard from NICU nurses, you'll have babies who have just recovered from brain bleeds. All right. And what do? It's not during surgical, the baby is, awake, and they will then put the baby through a circumcision, spiking their blood pressure, risking another brain bleed, just because they want to have a cosmetically happy looking penis for the parents, or all these other, the baby's undergone all these other, issues, and they're just getting ready to go home, and they will still then perform a circumcision. And then all of a sudden you see, oh, now the baby he's not latching anymore. And, he's going to be in the hospital now for another, week. When you follow these stories, it's just, it's so obvious how harmful it is and how ignorant, even, it used to be, babies born with certain conditions would be spared circumcision, and now they're not, now they're trying to cut pretty much every infant possible. The only ones spared are the hypospadias ones, because they hope to use it as graft material in the future, and NICU nurses, I think we should target, but again, we're dealing with humans, and we have to, they have to deal with their personal concerns of life and their career and all that, and so it's just basically it's a morality issue.
Yeah, it is. And I do agree with you about how pretty much all botched. if it's done without medical indication, then it's botched. So okay, so that's all the physical harms, unless you think there's something we've missed.
No, I mean, as far as physical harms, I mean, you could see, I think, doing, like a vascular study, seeing how the vasculature has changed from, I've recently, I have a friend who has twins, one who's circumcised, one who's not.
Yeah.
And, and I educated her, and she became an intact. It was just recently. And, I hope one day, her sons could be used as a, example, to compare one to the other, what's the, the blood flow, how much, how many veins are present, what's the arterial flow pressures.
I've been wondering about that more often, but I don't know how deep the vessels are and all that, and whether they get cut or not when you're cutting, all the way around this. I mean, here, let's use an arm instead. If I were to cut off all the skin all the way around here, right, would that affect vascular flow going out to the rest of my hand, all the way to my hand?
It wouldn't affect the deep ones, but there's some, if you look at any penis, there's so many superficial veins, and people will then say, oh, look, looks so ugly or whatever. Look, the veins on that. Well, those veins have a purpose. You know what I mean? That's part of the normal blood flow. Some doctors will even offer cosmetic, options to have them removed because of the appearance. So you just have this, straight shaft with nothing on it. And so circumcision does, it does fuse those shut, it causes, the vasculature, study is something I would love to see. Just, like a pre and post, like in the adult age, the difference. It's like a twin model, using twins. And the same thing with like the nervous system, using, studies that could be published, in different things, using like,
It already kind of surprises me. Anyone would think that seeing the blood veins on a penis would be ugly. I saw a video yesterday of The Rock, you know who he is, right?
Yeah.
And he has a YouTube, a TikTok channel, and he stopped and he caught this bus of all these tourists, all taking pictures and everything like that. And he stopped and said hi and everything like that. They all got excited. You can see his left arm, and you can see like this blood vein, just like, because he's muscular, right? And you see this blood vein that's like, circling around on his arms. Like, people think that that's ugly. I don't.
Yeah, no, I mean, it's of course, I mean, people have, veins. We were born with blood vessels for a reason. You know what I mean? Everything we're born with has a reason. Okay. Evolution, the last part of our body that would have been born defective, evolutionary, is our genitalia, because we wouldn't exist if it was born poorly. Okay. It's as optimized as you're going to get for 4 billion years or of evolution, or if you want to go back to the asteroid and us as little moles, 600 million, 650 million or 65 million years. But no, the mammal prepuce, it's optimized. You'll see, I mean, there's just, even in horses, people screw around with the prepuce. It's, we have a fixation with foreskin and with this dirt, and it has to stop at childhood. I think the key is, you have a kid, you teach them how horrible this is, how it's mutilation, how the baby screamed, the kids understand all that right away. It's so easy to teach a kid how wrong this is. And if they see, what a normal, even having just like you have like a normal, little kind of thing there, even them just understanding that's normal, seeing a normal baby brother right there, that woman, when she grows up, who had the intact brother, is not going to be afraid of the uncircumcised man. So, we're going to win. It's for all the intactists who get upset and depressed and discouraged. I get it, but we are going to win. It's, it's going to happen. There is no ifs, ands, or buts about it.
As long as people's, consciousness continues to rise.
It will, and I don't think there's any way there's no way it will not.
Yeah.
You know what I mean? We've got like way too many ideas that we haven't even tried yet that would do it, And with modern media, I mean, just I love Conan, I forget Conan's sidekick, but him telling Jeff Goldblum, how you mutilated your son on the show. That was just beautiful. Yeah. And Jeff Goldblum's like, you're probably right.
Yeah. I remember that show, that episode, sure.
And so I would just hope that all the intact celebrities and everything become more vocal. And
and not be afraid to say, hey, I'm intact and I'm happy, and I would never the dumb reasons that they spread.
And start connecting this with body shaming. If you start talking about this, talk about body shaming. If you start talking about, oh my God, foreskin, you never know what you're going to find underneath there. Connect it with vagina. Like, are you serious? You're talking about the growth. I always say, an intact penis on its worst day is still, better than, a vagina on its best day. So I'll make, these kind of comparisons, and I hate to try to be like vulgar and disgusting, but you have to be kind of to get that disgust mechanism shut off in people's brains and get them thinking.
Get them to question their own indoctrination.
It's what it is. This societal mental block we've put up, this cognitive dissonance. If we had our pool of money, I'd say let's hire a bunch of psychiatrists and psychologists, and put them to work figuring out the best ways to reach people, their inner psyche and everything like that. And but yeah, no, but it's inevitable.
Yeah,
You know,
I certainly hope.
I hope so.
I can only, yeah, in some ways, I'm so happy that I'm born in, or that I've learned this when I've learned this at a time when we have this, the internet and YouTube and stuff like that, because I'd be so frustrated. I think that my only option would be, if we didn't have this, I'd be out protesting constantly, holding
Yeah,
signs
protesting,
and
absolutely.
handing out papers or writing letters or whatever. But now we
Yeah.
have.
Yeah, when I was at the supermarket just the other day, it popped up a little card, a
But
little sticking,
yeah,
on the advertisement. So yeah, just do that.
yeah,
I
had a couple.
I carry cards around. I'd like to get a better made card, but yeah, you see it just.
I keep this. I don't know if I told you this last time, but I keep this book in my van when I go out and do Uber. The second edition though.
Rosemary, what a great person.
Yeah.
Yes.
I keep it in the van, sitting right in the center, right on the center console, so people see it, right? And that gives them the opportunity to say, "Hey, you having a baby, or what's that all about?" Or that, and it gets the discussion starting. And I actually had two great discussions yesterday. So one guy was like, "Yeah, it's BS." He's like fist bumped him, and then another woman was like, "Yeah, I'm actually been questioning that a lot. I'm actually pregnant," and I went into it with her, and she was so thankful for all the information and everything. So
right, and that's it. And you just have a couple people like on their side of not doing it, and then they'll decide not to do it. But at that point, when I find people who are saying, I don't think I want to do it, then I'll try to interject myself and say, listen, you're going to have to go through a few little hurdles. Here's my phone number. This is what to expect. You know what I mean? I'll say, can I send you like an email? And then I'll send them an email of, all these like things like we're talking about here, the little pitfalls, they're going to try to say that you need to retract. And then, a week later, your baby's inflamed pink foreskin needs to be amputated. All these little things, it really needs like, each parent kind of needs like a chaperone intensivist with them, really, that would be ideal, but, we're doing the best we can.
Yeah, for sure. Well, the next section is about how this affects sexual relationships, affects our partners and all that. And then I've got that broken up into heterosexual, anal, and homosexual docking. So first of all, the heterosexual, when I do the docu-series, there's actually women that have said, yeah, I thought that it was me, not having the lubrication or whatever. And then I started being with intact men, and it's like, oh, everything is so much better. Well, yeah, things are better because you have the rolling mechanism, and you have all that lubrication that is not just here on the glands, but all the way down the inner mucosa. So the men are bringing, when they're intact, they're bringing their own built-in lubrication too. It's not all on the female.
Yep. And the psychological damage male circumcision does to women is profound, because if you have a partner who, even say like, as a young man, having one of their first sexual experiences is having a very hard time getting off having sex with you, the girl's going to think she's unattractive. It's her problem. It's her fault. That's going to affect her. That's not in any calculation of circumcision damage of, no doctor tells a parent, this, when your son's unable to come with his first girlfriend, she'll be upset about her own body image. Male circumcision. They don't take
that far down the line. They just don't.
No, this affects female body image so much when men have sexual dysfunction having sex with them. It is, it's a topic, again, you could probably have an entire podcast on. Just, in my own experience of being, intact for all these years, I could just, there's more stories than I could relate of guys, who were having, who always had a hard time since their early years being able to, orgasm, and the effect it would have with girlfriends, to then not being able to as they reach a certain age, and the keratinization of their glands becomes too much, and they've lost what little remaining sensitivity they have had, or if men are left with a small remnant of a frenulum and then that deteriorates and then the effect that will have. That's a different topic.
You just keep giving me great ideas, man. That's an excellent point, though, that this is affecting our sexual partners, really not just female, right? But it could be affecting our sexual partners, males too. If men aren't able to get off or whatever with their partner, the partner is going to have a psychological impact. They're going to feel, like it's something about them. And so I just added another section to the next major section of the psychological impacts. I didn't even have it on the list. It's like, okay, it affects, children and medical professionals and parents and intact individuals. I didn't even think about the fact that it's affecting psychologically our sexual partners. That's wonderful, man. Thank you for bringing that up.
Yeah. And if you're unable to orgasm and you now don't have your endorphin dump, what's that doing to your mood? Are you going to be more irritable the next day, depressed?
Oh gosh.
Right.
Man.
Having a normal sex life is a critical part of, the human experience, human psychology. If you take that away from men, or, it's going to have an impact on their psychology. You could do studies, does it increase abuse? If you're, there's so many different aspects we could do. That's why I said, if we had a person, if we had a pool of money and we could do studies, there's, just idea after idea. If this is coming from like a person, who spent like his adult life thinking about these things, there's lifetimes of work that need to be done that would show damage that still is positive is there. It just has never been reported yet.
That's another one. Man, this is good. So yeah, the lack of endorphin dump from not finishing sex. That's another psychological harm that could happen. It doesn't happen to all men, obviously. There have been some cases where I wasn't able to finish because I got too worn out, whatever. But
right,
yeah, that's that is a psychological thing, and yeah, you kind of need that.
Right. Is that if you're having a workout, is that intimate? Is that like erotic? No, it's the partner, first of all, might be irritated as hell. You're worn out and now frustrated as hell because you couldn't get off. So what's a person going to do? What's a person, prone to addiction going to do? What's an alcoholic going to do? Maybe they're going to go have some drinks because they're so damn frustrated now or something. There's, so many different angles where it could go if a guy can't get off and, get his normal endorphin dump and feel good and just pass out unconscious because, it's, natural endorphins from sex is just, it's basic, basic human psychology. I think health 101.
Some of my best sleep is after sex.
Right, yeah.
It's just reality.
You pass out if you want to, every guy knows if you want to pass out what to do,
Man.
But and then you'll have guys who can't even get there through masturbation, depending on what time of cut they have. These studies are, there's no good studies that are done. The studies that are done by the pro-circumcision crowd are biased and they're bullshit, and I would say that almost like across the board, if you examine who these people are, you'll say, oh my God, I can't believe that we've been listening to them. We've been listening to a group of almost pedophile perverts who've somehow infiltrated medicine, people who write like circumcision poetry about how much better, and we'll say, oh, this person was, on the decision board of, is circumcision good or bad? And he likes to write poetry about how much better a cut dick or a cut penis, a cut baby's penis. It's just, it's horrific. Or, or people who share erotic stories. It's disgusting. And these are the people who have been making studies, and that you are following these studies. and you try to educate people, and it's almost like too much to believe, when you get into it. So
Yeah.
There's a dark side on the internet if you look into it. I mean, the whole fetish community, that is something you can see, and that's as dark as it gets into the human mind and psychology, where you see guys who are saying, oh, I have a problem. They go online looking for help, and they fall into these traps of people who are saying, oh, here, yeah, go get this most severe, worst type of circumcision. And it's, it's on things like Reddit, and, it's just over the internet. If you go and do your searches, you'll see it. It's there,
Yeah, I put that right up there with like trying to convince kids to go, swallow Tide Pods, or something.
Yeah, right.
Right. Those kind of, as far as I'm concerned, those kind of groups and sites and all should be taken down. I'm not much for censorship, but if you're inciting violence, unnecessary violence, especially, that should be censored.
I agree, and a good way to educate young people on the topic. You know what I mean? What would be a nice, good, appropriate way to deprogram, desensitize that disgust mechanism for young people? Like I like your, your little model there. You know what I mean? Very hard for anybody to say, hey, you got to take this video down. Look, he's got, a sock puppet. So I think that's a brilliant idea. When I saw that you have that, I said, that's so great. I love it.
It's not as good as this, but Dick Doc on TikTok. I've been following him. He has a big puppet.
That's fantastic.
Yeah. He hasn't been taken down, and he uses words that are just funny as heck. I love it. I mean, he hasn't talked about the whole circumcision topic at all, but I tag him from now and then on some videos. But yeah,
I would say, as far as like the psychology, I want to see comparisons of depression rates, anxiety rates, addiction rates, suicide rates. Violence and domestic violence rates. I always wonder about, these school shooters. Are they circumcised? Yeah. Did that early violence have any effect on their development of their brain's center?
A guy by the name of Jeff Bridges, he's been talking to me about like reaching out to prisons and like sending letters to men in prisons and asking them certain questions to try to get a survey. So
Yep. And I've heard and circumcised men being involved in much more different varieties of like kind of different types of sexual fetishes and stuff like that. Different things because now they need more stimulation of the brain to get off. So they'll get involved into more dark kind of stuff, BDSM kind of stuff, or violence, or So, I mean, if you alter the basic, the hardware, you know what I mean, then you might need to change the software a bit to get things working correctly. Or I think there's, so much, a great deal of psychological damage that's done. I mean, it just when a parent, if you look at like a circumcision being performed and a parent who's in the room and they have to walk out because they're so traumatized, or, parents who say, I don't want to have another boy, I can't go through this again. I mean, what a sick American thing to have to say, I don't want to have another boy and go through this, instead of thinking, oh, I'm just not going to circumcise him.
Yeah.
You know what I mean?
Yeah.
I don't know if I mentioned it. I think, when Ivanka Trump had her son, the bris, that she had to walk out. She was so upset. I've heard so many stories about that, the trauma that parents go through, having witnessed it. It's PTSD for the parent. The infant has gone through PTSD, and that PTSD continues for at least 6 months, we know. We know from the vaccination study done when they would compare vaccination of circumcised boys compared to intact boys compared to girls, that when you vaccinate a circumcised boy, they cry louder, longer than their counterparts, than their peers do. So it shows that there's been a change in that brain.
Yeah.
I want to see that study done at 1 year. I'll get to see it done, for people who are 18. What are the rates? What are the changes?
Yeah.
Because I always use the example, if you chop off, a kid's finger, of 50% of a kid's, of every kid's finger, will they have higher rates of something? And everybody would say, of course, it's going to have different, that these kids are going to go through different changes. Well, of course, we're doing that with their penis. So you've already, we've made the point.
Yeah. Some people will say, well, how can you miss what you practically never had? It's like, well, hello, if your hand would have been amputated when you were a baby and you went through life and you were noticing all these other people using 2 hands, you wouldn't feel some grief. You wouldn't be upset that was done to you without a medical need. Hello, all that us men have to do is take some time to look at how this works.
Right.
And yeah, the more you look at how it works differently and all that, and you're like, well, actually, that would have been nice to have. It's like, yeah, you're gonna get upset.
Fortunately, we're in a colorblind, analogy here, where the circumcised men, we're colorblind. We don't know the colors we can't see, and that we're missing out on every day, and
that's a good analogy.
Yeah, and to try to get that across, that's our challenge,
Yeah, it's kind of hard for someone that can see the colors to explain to you what those colors are like, right?
Yeah.
It's not something that you can visually see. And when it comes to genitalia, we typically don't see that other people's genitalia in action unless you're watching a lot of porn and you're paying attention to the differences. Or men that are intact are actually taking the time to explain how it works differently and how it feels and all that stuff.
I wish Daniel was on here, because I mentioned to him in a conversation how in like anatomy textbooks and neurology textbooks, they'll have a picture of essentially what the sensation is of a human. So you'll see a person and like the hands will be huge. You know what I mean? The lips will be huge.
Oh, yeah.
I forget what it's called. Daniel knew it right off the top of his head. But if you did the same thing with the penis, it would be the frenulum and the it would be all foreskin. So we need one of those.
That would be kind of funny to see.
Yeah, Daniel, please comment what it's called.
Well, we just share the video with them, and you'll jump in, I'm sure. Leave a comment.
But I think we're getting things across good. I would like to see another circumcision movie made that's focused on the sensation loss, the sexual loss, and the human rights thing. It's good to make a movie that's try to see both sides, but I would make one that kind of shows like the complete bullshit. I enjoyed, Penn and Teller's bullshit show. I thought they did a decent job on it.
And Adam ruins everything.
Yeah, Adam. Yeah.
All right. So we were covering the heterosexual level effects, and then there's the anal effects, and with anal you don't have lubrication like you do with the vagina, so it's even more important to have that lubrication, unless you just like using KY jelly or that the stuff you buy from the store, and having a rolling mechanism for anal, I'm sure would help a lot. So I'm sure that an intact man having anal sex is very different from one that is not intact.
I might be interested to see what the damage is to the recipient, of having sex with the circumcised partner, and that then brings up the same issue with having vaginal sex, with causing tearing and bleeding, and opening portals for HIV to enter.
Yeah. Yeah.
I mean, if you want to say, oh, circumcision prevents HIV, you can't tell me that causing tearing and blood is going to reduce HIV. There is no way. It's so blatantly obvious that you don't need to be a doctor or some, to figure out that, having an open wound and then ejaculating into it is going to, not increase your risk of contracting a disease.
Yeah. So someone that likes to have anal sex out there, hey, go have anal sex with a guy that's intact, and then go have anal sex with a guy that's not intact, and tell us how long you can put up with it before getting too sore. And comment on this video.
Yeah, exactly.
Awesome to hear. I've seen some anal porn, and the woman gets sore after a while and says, "Hey, gotta stop, gotta do something different." So,
how about a study? What are the rates of like anal fissures in Europe, in European gay men compared to American gay men? Damage caused by repetitive. That would be a study right there. There's another study you could do that could show damage. You could see that on the front page. A new study shows anal fissure rates increased in certain.
Yeah, of course, if we just stop all this genital cutting of children in the first place, then maybe no one would care about doing studies, right?
Yeah.
I'd rather just end this thing and not have to do any of these studies.
Yeah, but unfortunately, we have to have our infants appear sexually aroused at birth. But they can't look like a normal infant. They have to appear sexually aroused. I tell people that, I say, why do you want your infant to appear to be aroused sexually? Like a dog, like Red Rocket. And then they'll think and they'll realize, oh, wait, I never thought of it from that angle. Yeah. This could sound kind of perverse to another person who, doesn't do that.
Yeah, I actually, sometimes I respond to women that say, well, this looks more attractive to me. It's like, yeah, it's in your freaking DNA. Do you understand why? It's not complicated. When you see a guy erect, then it's basically telling you he's ready for sex. So your DNA is saying, hey.
Right. Yes. It's pink. It's like flushing, it's arousal. Anything pink makes you think, why do you think like a ape or a chimpanzee, their behind becomes flushed and red when they're ready to have sex? Okay. Pink means aroused, blood flow, things are, it's not difficult for educated people to, understand these concepts. If you're totally brain dead, you can listen to this, you'll be like, what the hell are they talking about? Monkey what? But so I guess we need to have like an IQ learning section. This is for people with the IQ of like between like 60 to 80, and this is not to be rude, but
if we could just measure like a horse, a horse sees a gelding, and is the mare turned on? Can we tell whether the mare is turned on by seeing that gelding? Okay, now the mare sees the stud who's sticking out all the way out there. Is she turned on all of a sudden?
Right. That would be that's a brilliant study. Unfortunately, the people who sell horse sheath cleaning supplies wouldn't like that. You know what I mean? I mean, that's so sick there. If people selling damn products to clean your horse's foreskin because they're so afraid of, it's just completely bizarre. And I can imagine being a sick person making a business out of terrifying people out of, But it just comes from an ignorant, evil, part of our history where we didn't understand a goddamn thing about science, about neurology, about how anything works. And, we think that the rantings of maybe somebody who had schizophrenia should still be taken seriously. And
we have over 1 billion foxes without tails in the world, and it's tough to wake those foxes up and say, hey, the tail is better.
Yeah, you can balance yourself a little bit better, but it
Yeah.
looks funny, and hey, it could get wrapped around a tree, and yeah.
It gets dirt. It's more than clean. Oh gosh. Anyways, and the last sexual partnership thing is the homosexual docking, and well, you can't really dock if you don't have the prepuse there to dock with. So you can play like swords, but
Right, you can't talk, and you can't, I mean, if you're heterosexual, you can't, like have women insert their fingers inside. You can't do that type of stimulation. I mean, you can't have just, you can't just simply stimulate the rigid band if you want to just feel that, or if just the frenulum. You can't, edging is an entire part of sex that's destroyed by circumcision. Okay, I encourage anybody, go and Google edging porn and take a look, and you'll notice that it's almost all circumcised, or it's almost all intact men. Or if you see a guy who's circumcised, they have a great deal of their intermucosal tissue left and their frenulum. Those are the people who are able to be edged, which means you could stimulate and give them pleasure for a long time, or as long as you want, without making them orgasm, just allowing them to enjoy those nerve endings and those sensations. Circumcised guys can't do that because they don't own those nerve endings anymore. Those connections going up to that pleasure center in their brain is disconnected. So we have disconnect, our pleasure center, part of it's disconnected because we're circumcised, part of it's not developed. I always question, sadly, if something like Foragin were to become successful and you could reattach, what would happen? Would the nerve impulses have a place to go even and stimulate? I'm curious. Yeah. But the brain is, the plasticity of the brain, hopefully, I'm certain that, circumcised guys, if you were to do like EMGs of the brain, you would find that, we've changed greatly how, we respond and what's activated, how we've adapted. You know what I mean? I know that we've adapted some ways, especially psychologically, with these, using different fetishes and stuff like that.
Yeah. I actually came across this video. I think it was yesterday I came across it. A woman was talking about the death grip on the man's penis and how men like need that, and someone else commented something about choking the chicken. It's like, when I commented saying, well, it's more, I think it's more common amongst preputially amputated or circumcised guys because they don't have that erogenous tissue to deal with. So what they're left with is pressure, squeezing that corpus cavernosum underneath, and that's what feels good to them. That's all that they have left over. So they're more likely to want to do that that squeezing thing.
Yeah, and you know what? And that is a great point. It's a great American thing we hear, the death grip. And then when the person goes to the doctor, they'll blame the damage on the person's grip themselves. They'll say, you've damaged yourself by being too vigorous, and you're addicted to pornography, and all of these different things that are related to the initial circumcision. It's like, no, you have this grip because you don't have any nerve endings left. You're desperately trying to excite the few remaining nerve endings so you can reach an orgasm, because you're not going to stop until you get there. I mean, unless you become totally worn out and you're, So, and that's what the doctor will do. It's fascinating to, when a man goes in for a circumcision and then they come back, once they're fully healed. First of all, they'll go in, they'll have the circumcision, they'll come back to the doctor, they'll say, or they'll text the doctor, say, I have all this lymphatic fluid draining from the area where the frenulum was. Because these guys they usually have the frenulum removed when they're circumcised as adults. I can't understand how any man could amputate a frenulum, but urologists amputate them and they say, no, the nerve endings are underneath there. Or there's lots of guys who have, who have babies without frenulum. So, they'll amputate that obviously, like most highly erogenous area, area that guys will call like the booty bullseye, or even the male clit, they'll call it, incorrectly, but I understand what they're trying to say. But yeah, so there'll be lymphatic fluid draining from that area. This yellow fluid, they'll say that's, that's fine, that'll go away. Then when they're fully healed, and the sensation starts to go away and they have sex, if they've had phimosis for a long time, they might find, okay, things are, a little bit, different. Maybe it's a little bit better, because now they can actually feel some stimulation. But if it was a man who didn't have any kind of like a phimosis before, who was fully retractable, fully healthy, they'll go back to the doctor and say, doctor, I can't feel anything. The feeling is gone from my penis. And then stage one is the doctor will say, well, you're still healing. There's still swelling. Give it some time. I'll come back and we'll see you in a month. They'll go back and they'll realize, holy shit, things still haven't gotten better. They'll be depressed. They'll be, they'll start to become like, despondent. And the doctor will say something similar, or they'll be given a card for a psychological evaluation, like there's something wrong with their brain. They'll be told it's their issue. You haven't gotten used to it yet, or, what you lost isn't important. You didn't lose anything important. This is your problem. They won't say, oh yeah, sorry, you lost important nerve endings. And, that feeling that you enjoyed will not be coming back. You're circumcised. Sorry, I didn't, mention that more forcefully before I had, I talked you into this. Or I didn't mention it in the informed consent. They'll simply say, no, studies show there's no difference, or, they'll cite some of the bullshit from some of the perverts, and, they'll deceive ignorant young people who are, who've been conned and shamed by American society to have this done. And those stories of those boys and men who've had that done and who realize, they just had their sex lives ruined. Those are the catastrophic things we see. And that's why I'm not surprised when I hear, oh, there's another suicide, or talk to another guy who's like, I'm so depressed. And as intactivists, that's what we deal with every day. That's what we see every day.
Yeah.
And so, we talk about all these different issues, but that's like the bottom line of what we see.
Yeah.
And it's as life destroying as a thing could be, especially if it's done to an adult and they realize what they've lost. That's an issue. For men who've had phimosis and never were fully retractable, for them, they might say, oh, I can now actually feel something, but they don't know what they lost. They could have been treated differently and have had a full normal sex life. They unfortunately got conned into this, fully damaging procedure.
Yeah. The gamer Mewtwo King, MEW2 King. K-I-N-G.
Yeah.
Yeah. If you look up Mewtwo, MEW2 King, one word, circumcision, it pops up. There's a video on YouTube where this guy who's, he's I guess he's a really well-known gamer. He talks about how he's, very heavily damaged by his, circumcision.
Yeah. Or if you Google things like, guy unable to get off or something like that, you'll see it's always a guy who's been severely circumcised. You won't see these type of things in an intact guy who's having these problems. It's always a guy who's had, either no frenulum or, a great deal of intermucosal tissue. That's the pattern we always see. It's totally obvious to us, and that's why it's horrifying when, to me, the worst thing is when I hear, oh, a baby's going to have some surgery at 6 months to correct whatever. Oh, and they're going to circumcise them at that time too. And to me, that's horrible, because lots of times they won't use a Bell method, they'll use a freehand method, and then they'll remove every scrap of inner foreskin, except for maybe like a millimeter, because of the HIV, portal study. And I'll tell the kid, I say you're going to completely wreck his sex life if you do this. And it's so horrible when you lose the parent when they don't listen. And educating these surgeons, I mean, it's sad, but they want that money. That's their income. That's their house payment, their car payment,
I would like to meet someone that has a lot of training, not necessarily urology, but dermatology and nerves. What do you call it? Neurologist. Take all three of those together and talk about the subject. That'd be really interesting.
Yeah, and some sexual therapists.
Oh, yes. Well, there's quite a few out there. It doesn't take much searching. There's Sexplanations on YouTube. There, Dr. Doe is the person that's a sexologist behind that. There's some others. I keep trying to get Dr. Marty Klein to talk more about this issue, but he seems to be. I think he's biased, and I'm pretty sure that he's cut. He addressed this once and not into too much detail. So he was basically writing off the men like us that complain. So.
I know a very educated therapist on sex too. I'd have to ask him. His name is Kurt, and I don't know if I should use his last name on here, but he's a very educated man and educated on the subject, and so I'll have to ask him. I'm sure he would be probably interested too in taking part. But that would be a very interesting group of people to get together. Have a few intactivists come there to educate all of them, and have have them appear at a conference. It would be great.
Dr. Doe is definitely an intactivist. She definitely supports leaving.
Yeah.
Thinking keep things intact. Yeah. So.
Yeah. I mean, in any kind of different method to get our message across. It's great that the AAP conference is coming up. That'll be good. That's going to be shared on Facebook a ton, I'm sure. Have the AAP in Philly, I believe, coming up.
Yeah. And Plastibell are going to be there and all that, and they're going to do a whole tour in that area.
Yeah. I'm going to go protest around the Northeast.
Talk about sexologists again. I'm maybe I should do a search, but I haven't come across a sexologist yet, other than Marty Klein, that is not pro-intact. So, anyways, that would be really interesting to come across one that, is pro-cutting. So,
if they are, I would be interested to, you mentioned that you have had conversations with Andrew. I have, a book's worth of debates with him, and I have just found him to be not, he's not consistent, he's not honest, and reliable. When he's defeated and logically, just defeated in a debate, he will never admit to it. He will always fall back to it. He's just not an honest person to debate with. So I stopped debating with him. I said, this is pointless right now. You're never going to be able to get somebody to admit that, this is actually what you measure. You know what I mean? This is the amount of tissue, not this, when it folds back together. You know what I mean?
Yeah.
He
won't acknowledge that the prepuce has any value. And as long as he's stuck on that, then
and it's for religious reasons, I think. I'm pretty sure. I don't know if it's for fetish reasons or religious.
He's Jewish. He's cut, and I wanted to bet that he has
fetish reasons.
He has many reasons. He's very he might call us biased, but he's not.
I would say, Andrew, come on, join us. Let's have a discussion, for everybody. But for some reason,
Wilson has challenged him to a debate plenty of times. So
I would love to have any urologist come on and have a debate, about why infants should be cut. Let's talk about the reasons infants should be cut. That's all.
I'm totally willing and ready to chat with any medical professional.
Well, where is that debate? Why it's 2021? How come? How come they won't come on? Where are they? I ask them all the time, but it's always a no. Like, why? Why do the only time I was able to get one to go on, I had to pretend to be some pro-circumcision anti-protester. It's like, well, why do we have to trick you to actually get you to talk and expose your ignorance? That's how that's how I know it's a dark side. There's a very dark side about this because they refuse to come and talk.
Well, there have been some doctors, particularly coming from like India and Mexico and other places outside of the U.S. that have gone to the AAP and have actually had conversations in front of camera with the protesters and have been on our side of it.
Yeah, Cecilia Norquist from Norway, I love her.
Oh, yeah. That's right. Yeah.
She's like, men. I'm like, how often? I think it's Brother K. How often do men need to be circumcised? She's like, never.
Yeah.
And I have one video up with a doctor. I think I made it into a compilation. A doctor from Mexico and one from like El Salvador, and another one, and all of them are like, no, men never need to be circumcised. I haven't seen this, or this is men don't line up to get cut in our country. It's not something we see. I fear what I fear is religious anti-HIV, non-governmental organizations trying to push this into places like India and China, where there's mass amounts of people, and a centralized government that could mandate, yes, this will be done. It's something that I worried about. I know I've heard of things about them trying to get this pushed into China and places like that, where you have a quarter of the world's population.
There was the Shang ring was invented by a Chinese person, so that's a little bit concerning too. So.
Yeah, but I would love to just get groups like that really on our side, like the Chinese medical community. It's like, oh, cool that you like to use herbs and stuff, but just be against circumcision. Make sure you understand the anatomy of this body part, okay? It's critical. Unfortunately, we just see them developing devices so anybody can, so you can circumcise yourself at home, and it's just disturbing. And how the inventors will not debate. The inventors, refuse to come, and they refuse to be forthright.
Yeah.
Refuse to,
Yeah, for sure. Sure. That's interesting. Let's be over here. So the next section is about psychological impacts, and the first part is about the trauma from the cut itself. And I avoid telling people too much about this book, just the fact that it exists. Every time I think in my head of sharing anything really too much out of it, I even had one case. I think I read a little blurb out of it and stuck it on TikTok, and it kind of came back with people not, of course, obviously not agreeing with it. The thing is you kind of have to read this book all the way through to get it and to accept anything that it's suggesting by the time you get to the end of it. So you can't. This is one of those books you definitely do not go to the end of without reading it from beginning to end. So and the book focuses mostly on the trauma to babies, and maybe how that affects us throughout life, and maybe how it affects other people, how it affects us all. Ultimately, as it says, how an American cultural practice affects infants and ultimately us all. And that's part of what I'm trying to express here by going through the entire list of my outline on this, is that, yes, this does affect us all one way or another. So, and then even this book by Jay Jackson, who happens to be in LA, I got to meet him. He even talks about how he had nightmares through much of his life, and he's not the only person that's testified to nightmares that is connected to that, but I'm one too.
Me too.
Oh, really?
Yeah.
Oh,
Yes.
that's interesting. I often had nightmares where it's like I was paralyzed, couldn't move, right? And something was approaching me, and something, I don't know what that was, something, but I knew that it was horrible what was going to happen to me. And I'd always wake up and, huge sweat and just like shaking and all that afterwards. So
You'd be interested in that's a phenomenon that's found often, with the people who claim they've been abducted by UFOs, and it's that sleep paralysis, and when you're paralyzed, and you're still in that dream state, it'd be interesting to see if there's a difference between Americans, and Europeans, people who aren't circumcised, because often they'll say, it resembles something like birth. Like you see this, people around you in this bright light and you can't move. And, so it's interesting. And it sounds to me more like, like being circumcised or something like that. You know what I mean? You're being, completely restrained and people are taking you away. And, I'd love to tell new mothers, think about it like this. So they're going to take your new baby away, okay, who's supposed to be spending this first week of life learning to bond with you and daddy, to learn to trust you, just be comfy, cozy, learning how to breastfeed properly, and just absorbing the world, or you could have him spend the first week of his life in extreme agony, having gone through this extremely traumatic procedure that, would be considered the worst torture if it was done to an adult. If this was you've been sentenced to circumcision for this crime, people would say, oh my God, that's horrible. That's something the Taliban would do or whatever, it would be too much. Nobody would allow it. They'd say that's torture. It's the worst form of torture. But for some reason, for infants, it's okay because we claimed that they don't feel pain and we're still sticking to that, or that some numbing gel is going to help. I was like, okay, let's pretend, for instance, that the numbing medication does work, that they don't feel it. They're still totally restrained and terrified, and they've gone through that. But the medicine's going to wear off, and they're going to be in agony, urinating and irritating, and having an area cleaned, a skinned head, and that's agony for an entire week. Yeah. And the person doing it to them is the parent. What's the association going to be? How is that going to affect the bonding between the parent and the infant? Yeah. How's this going to affect breastfeeding? You can't tell me that an infant who's screaming in agony is going to be breastfeeding as good as an infant who is comfy, cozy, and, all here is, over and over again is, my baby boy who wasn't circumcised was the only one not screaming in the nursery, and that's a common thing. I've heard that so many times from nurses who work in that setting. And I've also heard of a nurse who was forcibly trying to fully retract these infants. And when the infants would bleed, you would say, oh, that's normal. All babies do that when you retract it. And so just completely sick, disgusting things like that. But no, and if you tell a parent, a mom, you need to trust your instincts. Your instincts are there for a reason, those are, I like the mama bear, trust your instincts, you need to protect your cub. If somebody's trying to take your baby away and hurt them, and something inside you says, this isn't right, you need to trust that. Take the baby home and think about it for a week. Do some research. You don't have to do this right away. What's this rush? Why is everybody trying to rush you and pressure you so much? That's the used car salesman hard sell technique. That should make you suspicious.
Yeah.
Yeah.
I often see these things, like for instance, that nurse that did this TikTok video recently, or videos. It only takes 5 minutes or whatever. It only takes a second for a guillotine to work.
Yeah. Right.
but they also will end up talking, well, how many days does it take to heal and all that? It's like, so is the baby going to feel pain during the healing time? And you even talk to men that got cut as adults, or have it like try to do auto circumcision as adults, and they're like, this is like on fire, right? The glans is on fire, and just like anyone knows that's had a cut, the cut might actually hurt for a day or 2 or 3 as well, until that heals up a little bit, and anytime that it gets touched by something bad, it might get re-inflamed and all that, like Jansen's feces and a diaper, starts touching it. So you've got the cut, and you've got the glands that it's exposed, and so the baby is feeling pain for not just 5 minutes or 10 minutes or 20 minutes.
And the glands, it's not just that it's now fully exposed. First of all, it's not even developed yet, and it's been skinned, because you've either skinned the inner foreskin or the tissue of the glands. That's why there's bleeding on the head, and you have to.
So when you think about it, if adult men are saying this is on fire when it's exposed, to the air and everything, just imagine, just like you're saying, if it's not developed on baby, how much more on fire is going to be for them?
Of course. And it's, and like I said, like circumcised guys, first of all, they'll be walking around in, circumcised mode, but they'll put a cup around it to protect it. So it doesn't, so they don't feel it. An infant can't do that. An infant's in a diaper, the parent is doing it. They have no control over it. They are just in agony. They can't control it. It must be a living hell for them, honestly. How's their sleep during that first week? How the plasticity of the infant's brain, it's so plastile at that time, and it's developing so quickly, activating all the areas that are related to pain and trauma, and now like not trust, and it's not directed towards bonding and love and all this. I just can't imagine, what the possible effects of this could be,
Yep, for sure.
Forward to in the future, if anybody does a study, on adult men, maybe somebody should put in some FOIA requests to the FBI about crime rates, with the word circumcision. Why don't you FOIA circumcision, increase, things like that. Somebody who knows how to do some private. I had that idea a little while ago. On how to, properly put in like a FOIA request to find that out. Because I once heard that, the FBI had once done a study on, and found an increase, but I found no information about that. But that's something else we could do as an activist community. Let's file FOIA requests. There's a lot of different things. There's a lot of different things the government has information on.
FOIA, right?
Yeah, Freedom of Information Act requests, and so the government will then have to search their files for anything related to it. And so if the FBI has information that, circumcised men are more likely to commit, violent sex acts, well, then that would be a great thing for us to have. Very interesting information.
That's out to Jeff Graves. That's a good idea. Take advantage, leverage that FOIA thing that was it Obama that enacted that?
As far as the history of it, I'm not sure who started it. I'm not sure about who started it. I know it's something anybody can access.
Yeah. Interesting. Good ideas. All right, the next thing is not just the trauma from the cut, but the trauma from the discoveries of the loss or the harm. Men like you and I, we start studying and we start looking at how things work differently and all that, and we start realizing, that we're missing out So
Yeah.
that's
Well, like today, I woke up at, I was out late last night, but I woke up at 2 p.m. today. I was pissed off when I woke up. Now I'm doing this, so that's how it affected me today. But it's affected me every day for the past since I would say probably since I first noticed it when I was 5, and I mentioned that in our first episode.
Yeah.
So it's affected me in some way since then. I became very upset after learning more and reading the book The Joy of Uncircumcising, and I was pissed off from that age a great deal. And I remember even in high school, another guy saying how pissed off he was during a home ec class, and like the look on the teacher's face,
When was it that there's 2 editions, right? Of the book? Oh, this is the 2nd edition, and this is the 1st edition. So I'm just kind of wondering, how long ago did he write this?
Well, I was working as a security guard, and it was probably right around college, so probably around 2002, 3.
1992 was his first
Oh,
edition.
wow.
Wow, I didn't realize it was that old. Interesting.
Well, yeah, when I was working as a security guard, that's long after I had read it, actually. So I think I had read it when I was a young guy. I was pissed off. I was pissed off about this. I mean, going through, grade school, I was pissed off about it. I think maybe since I was a small child, I knew something was different, something was wrong, and it didn't sit right with me. So yeah, but now the damage it did to me since then, it's caused me depression, anxiety. I've had issues with addiction that I struggle with every day. Circumcision does not help that one bit.
Yeah.
So I work very hard at my sobriety, and, intactivism, is stressful. So I'll do things more like cut and paste now, or like things like this. I would enjoy doing a podcast. But yeah, so it's affected my life in a very severe way. I would say that my issues with addiction are directly related to my circumcision, and I have zero doubt about that. Now, I'm sure I've even had people involved in addiction medicine, and I have a lot of experience in that, who would say, "Oh, don't you try to blame it on that," or and that's like something you would never say to a person. If somebody says I had a sexual trauma, they would say, "Don't try to blame your addiction on that."
Would you tell that to a woman that's been horribly raped or something?
Exactly.
That's horrible. Someone would say something like that.
Yeah.
But yeah, but we're men, so and that doesn't really harm you. Whatever. Prove it.
No, and I don't like to compare traumas, but
we don't need to have an impression on
we'll say right, exactly. We'll say well, why? What's different about this? We'll say, well, the woman was forcibly penetrated, so was the man. Foreskin's interior tissue, a probe was inserted inside and then tore around. The infant was restrained, where the young boy was restrained, and the man is now missing that body part.
Yeah.
The woman still has it.
Yeah,
she has not.
Exactly. If you had a choice of being, raped, penetrated, or having part of you cut off, which one are you going to choose?
A dirty trick I'll use is there's, of course, the horrible images, of when children are being forcibly circumcised and they're all screaming. And there's no difference between the face of a boy or a girl. The scream, the face, the look of terror in the eyes is exactly the same. And so I'm making a compilation of just those faces and saying, what's the difference? Yeah. The experience is exactly the same. So if you're saying the experience that the girl went through during her genital mutilation had a negative effect on her and was a horrible experience, there is no way you can honestly say the same thing is not true for that young boy.
Absolutely. Yeah. Ethically, it comes down to the same thing. It's non-therapeutic, non-consensual. That's it. Why do you need to label it with sex? You know, male, female, and intersex, or anywhere in between. Okay. So yeah, we brought this up before, that it does sometimes lead to suicide, and I'm afraid that we haven't seen the end of those.
I'm afraid that we only know about like less than 1% of those.
Probably.
Because, you know, first of all, what percent of guys who are pissed off who are circumcised ever mention it?
Yeah.
If I were to guess, I'd say it's probably a 1%, less than 1%, you know. These guys don't talk about this. This is not a subject you can get guys to talk about. It takes a very unique type of person to come up.
And some will like talk to me, but they won't go public, right? They'll, you know, they're too afraid to go public about it because of all these fears of, you know, losing status in society or losing their career or whatever.
The first time I had that same fear. The first time I went to a protest, with Lauren Meyer and a great activist, Lori Stern. And I wore a mask. I found like a blue mask at like a dollar store, you know, so just something so like my face wouldn't be there when, you know, if this would be on Facebook. So it wouldn't affect like my nursing career, you know, with my colleagues or whatever, saying, oh, you're anti-circumcision, and make it, you know, into a controversial thing with them. You know, there's always a fear, you know, it's a fear of mine even now that, you know, like colleagues will say, oh, well, I circumcised my son. How dare you say I injured him? You know, like, I'm sorry, I can't change what has happened. You know, it's happened. It's something that we have to deal with. And it sucks that we have to deal with it. But that's why that's why I'm doing this. So nobody else will have to deal with it in the future.
Yeah. Anytime anyone brings up they use the term anti-circumcision, it's like, no, I'm not anti-circumcision. I am pro-genital autonomy. You want to circumcise yourself? Have at it, but leave everyone else's genitals alone. It's not complicated.
That's absolutely right. Yep.
Yeah.
As long as, and if an adult guy wants to get cut, hey, dude, as long as you have informed consent, and as long as, you know, you've been, you know, if I was the surgeon, I would say, why do you want to be circumcised? And if they say, oh, because I'm being bullied by my XYZ, I'd say, first, here's a psych, you know, I want you to see therapist Joe, and I want you to talk to him for a little bit. After he comes back to me, then we'll talk about amputation.
Yep.
You know what I mean?
I certainly would not be the person cutting it off of you for sure. But I wouldn't even tattoo you or do ear piercings. That's just me. I'm very much anti-mutilation. Period.
You're right.
Yeah. But I believe in, you know, I believe in autonomy. I believe in freedom. And if I were to say, no, we can't even allow adults to do it, well, that's anti.
No, I'd have a problem with that. If somebody said an adult couldn't choose to do that, I'd say, no, that's wrong.
Yeah.
You know, as long as an adult has been given informed consent, they understand they might lose, you know, they will lose these nerve endings. This sensation will be gone. Yeah. It is important. They're not completely, you know, they weren't bullied or forced into it in some way. And they're of sound mind, then fine, do it. I might not like agree with it and think you're wise for doing it. Yeah. I might not want to come to your party, you know, afterwards. But I'm not going to try to legislate a law against it. Yeah. You know, I only care about if you're under this age. You know what I mean?
Yeah. And then there's a psychological effect on children. And I'm not talking about just children that, you know, got cut, obviously, or I'm talking about children like my own. I have 2 teenage boys who see mom and dad, you know, talk about this a fair bit, and especially online and all that. And they see my social media and all that. And they even join me in protests and stuff like that sometimes. And I worry about their psychological health over it. However, I think of Greta Thunberg, for example, who managed to get into the UN and speak very well, I think, you know, about a topic that she cares about. And her dad wrote up a little story about how when she first started learning about the issue that she cares about, global warming or whatever, climate change, whatever you want to call it, she went into a depressive state. And then one day she went and held a sign out on the street, advocating for a change. And that's when she opened back up and became a happy person again. And all that. So.
Absolutely. If it's something that you've been, keeping bottled up, finally coming out about it, and protesting and saying I'm pissed off, and, even getting out there and, being, an antagonistic protester or whatever, it's good. It's therapeutic. Being an antagonist is very therapeutic. It's stressful, of course, if you lose a child and being exposed to the ignorance of our society and how sick it is. But there is really nothing better than, saving a child. I used to equate it to when I was younger, and I would ride on the medic truck, to saving somebody's life, like somebody having, a heart attack, cardiac arrest, bringing them back. You'd be like, oh, save. Saving an infant's even better than that. Saving an infant from circumcision to me it's better than like saving some 60-year-old guy or 70-year-old guy's life. You know what I mean? Because I would save that kid's entire like quality of life for the next 80, 90, 100 years.
Yeah, sure. There's a psychological effect of medical professionals like yourself, nurses and doctors that exist out there that, they're around these people that are doing this or promoting it. And it's, as you know, it's hard to speak up without worrying about getting fired or slapped on the hand or whatever.
There's no doubt. I mean, I once had an incident where I had to bring an issue up, and it was very stressful for me. And it did concern me. And I was at my favorite job. And, I'm like, damn it, I don't want to have to do this. But if I didn't do it, I would feel even worse. So we're in that position where, we're damned if we do and we're damned if we don't. So I don't want to have regrets about any of this in the future. So I just go ahead and do what I can. I do what I can to the best of my ability, without over stressing, overburned, killing myself. And, so that's what I do. But of course, I mean, and I think of the, medical professionals have, to be able to do painful procedures and things like that. We have, I'm trying to remember the word, how we turn off our emotions. But I mean, think of a doctor learning, how to circumcise and show no emotion towards it, and just do this, and act blank, and then do it over and over and over and over. And all of a sudden the baby screams mean nothing to you. Yeah. You've dehumanized an infant in this one way, in every other way, they'll still consider it a human with rights. And, they'll wear signs, I support children and this kind of stuff, while at the same time they participate in, this cultural ritual mutilation. And they don't have the gumption to stand up and say, I will not take part of this. There's so few. So many know, and so many know about it, and so many are educated, and so few come out against it. It's, like I say, it's discouraging. It, discourages me about mankind.
I hear you, man.
I think there should be more than 10 times more of us, 100 times more of us out there.
Yeah. About the childrightsnurses.org site, right?
Child rights for the, yeah.
Yeah.
I think you mentioned it last time. Yes.
Yeah. Okay. Yeah. There's a whole bunch of nurses' stories there, and you can even click on more stories, which takes you to circumcisionquotes.com. So.
Yeah, Marilyn Milos was one of the original ones, right?
Oh yeah, one of the original
Marilyn,
that ended up getting fired for telling parents, facts that upset the parents.
Yeah.
And they,
Yeah.
you know, of course, the hospital is more concerned about upsetting the parents than upsetting the baby, the actual, you know, patient.
Of course. Well, yep, the baby, I mean, the baby's not paying, you know, the parents are paying, the doctors want their money, you know, they don't want to be, you know, spending their time at a hospital where they're not allowed to, you know, I tell them, you know, I tell parents that every baby boy is born with a $300 coupon on the end of his penis, you know, and all they have to do is cut it off. So, and it's just, you know, it's just so demoralizing. You know, it's very interesting the different methods you will use to educate, you know, somebody like a nurse compared to a mother, compared to a father. You know, there's different techniques you use to educate different types of people, you know, different professions. So in its activism, there's really, I mean, so much you can learn, you know. It could be a doctorate if this was like you know, a college course, you know, I mean, there'd be like a doctorate in activism.
Yeah, for sure.
No doubt.
Yeah, I know Daniel has been talking about, you know, putting together some sort of certificate program, something like that. Yeah, getting people credits or whatever towards college by, you know, doing the studying and all that. So I think that's a great idea if we can just get it accredited or whatever we have to do. All right. Okay, and then there's the psychological impacts to the parent. Hey, I'm a parent. Yeah, I'm not a regret parent, but I came really close, and that alone really bugs me. It's like the idea that I would have let that happen to my son, and then, you know, I don't know where I would be right now if I let that happen to my son and then learned what I have learned since then. That would be very upsetting to me. You know, you think the trauma from the cut or the trauma from the discoveries of loss of harm are horrible. I think trauma to a parent, knowing that you harmed your child, especially the more that you learn about the harm, that's just devastating. It's something that, you know, only parents can relate to.
Yes, I can't imagine, you know, a mother who, you know, lacks like the moral fortitude and strength to say no, you know, who knows it's wrong, who knows the damage that's going to be done, but is getting pressure from all these different sides and allows it to happen. Those are the moms who say, I don't want to have another boy. I don't want to have to go through this. And I mean, I can't think of anything more inhuman for a mother to say than I don't want to have another child or one of this sex, you know, because I can't say no to, you know, not allowing him to be genitally mutilated. It's like, you know, where's your, you know, do you have any courage, any, you know, moral fortitude whatsoever? You can't just say, we're not doing this and that's it. You know, you try to do it, I'm going to go to court. We'll file for divorce. You know, is it that important to you? No.
Yeah.
So I don't like your circumcision. I want you recircumcised to like this. This is how you're, you know, you want our son circumcised, fine, but you're getting recut too, to my specifications. Yeah.
I often refer to how us advocates for genital autonomy or activists have to peel away the layers of cognitive dissonance with people. You know, like we often have to deal with, you know, addressing the whole medical benefits thing, and then we have to address the religious thing. I think that probably the hardest thing to peel away is the cognitive dissonance of a parent that's already cut their child. I think that would be harder to peel away than. Of course, I'm not deeply religiously indoctrinated. Maybe I'm talking from my own point of view here. I just think that you know, for me, definitely that would be the hardest peel to peel away for sure.
Yeah, I can't imagine that. I think that's definitely one of the hardest ones. That and you know, getting past that initial like disgust mechanism to what this looks like something I've been taught. It's like it's like a copperhead rattlesnake about to bite you, you know. Yeah, but I mean, parents, it's, I'm not a parent. I've never done that, and I haven't participated yet. So,
Yeah.
yeah, so I don't have that. Thank God, I've got the just the stress of trying to have it stopped, and from me, like the consequences of having done that. And intactors, we suffer consequences from what we do all the time. You know what I mean? Our social media gets blocked.
Yeah.
I mean, we have tons of consequences with friends, with family, with employment. So it's a hard type of activism to get into, because it's not a socially acceptable one. I mean, what other activism is out there that's not really socially acceptable? Nobody's yelling at you if you say, save the rainforest, or, but that's why I'm thinking people like Untitled.
I think veganism gets attacked plenty because people like eating meat, but
yeah, right. I tell people I love Christopher Hitchens. If you Google Christopher Hitchens, like Circumcision, and watch his YouTube, watch him destroy the rabbi who compares his grandson's circumcision to a haircut.
Yeah.
Or Hershey. I mean, she's a wonderful speaker. She was genitally mutilated, and she is vocal on the topic. These people are atheists, so it depends on a person's political and religious leanings too.
Surprisingly, I saw a tweet or something, I think it was yesterday, about that Christopher Hitchens rabbi discussion, and it appeared that they were actually siding with the rabbi. Like, really? Oh my gosh. Okay.
Yeah, I mean, it's just.
I kind of wish that Christopher would have attacked him more on it. It's like, well, it's not just about the pain that the baby goes through during the procedure. It's everything that goes on for the rest of that child's life.
I do too. I wish he was much more vocal on the topic than he was. I think doing the atheism thing is great. If that's what you're into. But I mean, he was an activist. He should, and he had a huge platform, and he could have saved so many more babies than he did. So yes, that's one thing I fault. I mean, I don't agree with a whole lot of his politics or anything like that, but he let a lot of babies go, and
Oh, he's still alive, right?
No, he died.
Oh, did
he had cancer. He died down here. It was like 5, 6, 7, 8 years ago.
Okay. All right. Then there's a psychological impact on the intact individuals, particularly those that are living amongst those that are not intact. It's like, instead of having a whole bunch of intact foxes with tails versus and having only one fox without a tail, it's like most of the foxes around you don't have tails, and you're the one that has tails. So trying to convince everyone else that you're better off to keep the tail.
That's
challenging.
That's a tough one, because then it comes down to like the high school shower bully that we try to dissuade parents from. We say, you're going to have your kid cut because you're afraid of some junior high school shower bully saying, laughing at your penis. Ha ha ha. That's why your kid needs surgery and amputation.
So you're going to, be your kid's first bully. You're going to teach them to give in to bullies, and you're going to teach them that consent does not matter. Lovely parenting job there.
Right, yeah. And our media, it totally is okay with it. We're anti-body shaming in every way except for this one way, this one thing. And how many, so why is it okay to shame how many millions of intact men out there? It's okay to shame these guys and say that they're gross and that they're disgusting and this and that. No, I mean, it's just a fail. It's a complete failing of the editorials and the people who run, and it's the religious ownership of much of the media that allows it to happen. you know, people who write these shows and.
Yeah.
You know.
Yeah, I actually had a couple in my van recently. I was taking them to her birthday celebration to a very nice place along the coast and all that. And so it was a fairly decent lengthy drive. And they recognized the book, and they actually brought up the conversation and everything. And he's Hispanic, and he's intact. And he was honest with her that, you know, actually, if I would have been asked when I was in high school, and these two are high school, you know, sweethearts. So he was a football player, and she was a cheerleader and all that. And so, you know, beautiful couple. And he was like, yeah, if I would have been asked in high school, I would have lied. I would have said, yeah, I'm circumcised, even though he's intact, because he's, you know, he was scared of, you know, the stigma around it all. But now he's like, I'm totally confident now, and I'm wanting to even do a video and everything to speak out against this. I fully support, you know, this advocacy work, and it's like. And so I got them to their destination. It's like, hey, you guys want to do just a really quick video? And so I like, yeah, sure. So I did, you know, just like a 1 minute TikTok video, and I aimed it at him, and he's like, yeah, I'm intact and I'm happy. And then I aimed it over at her. It's like, yeah, and I'm even happier.
That's fantastic.
Like,
I
yes.
love that.
It's like, see, what there are women out there that, you know, like having a natural man. So,
That's fantastic. I've never been, I haven't gotten into TikTok yet, but that sounds like an awesome avenue to,
yeah.
to activate. Wow. Very cool. What a great idea.
I got lucky, and I ended up going further up the freeway to deal with other rides, and then I told Uber to start taking me back, and it turned out to be timed just right, where I ended up picking them back up, taking them back home. So.
And what a great thing to tell a parent, who's afraid of the shower. You could say, well, you could just tell your kid to retract and appear cut if he's going to shower and he's worried about it. He doesn't need to appear. Nobody's going to know. Nobody could tell.
Yeah.
I
often raise that up with women that are like, oh, he's, too often that I run into guys that are dirty down there. It's like, then before you have sex with them, take them to the shower with you. Have a shower with them. It makes excellent foreplay. I mean, it's great for both of you. And clean them,
Yeah, clean each other. Clean each other.
There a little bit. Oh, come on. This is, oh my.
Yeah, when that happens, then I'll get discussing again. I'll say, yeah, you clean, and but as soon as he goes in and comes out, then it's dirty anyway. So you can, what I mean? So then you've gone back into shaming her, anyways. I hate the reverse shaming, but it's useful.
Or they'll bring up the smell thing. I'm like, have you ever smelled a vagina? It doesn't smell like roses, It's not like it lacks smell. It always smells like something every single time. So,
it's like every other object in the world.
Yeah.
Hey, listen, I got to run at 7.
Oh, okay. 4. Yeah. Okay.
But yeah, I'll be happy to do another time with you if you want.
Okay. Yeah, we'll have to do a part 3, I guess. We always have so much to talk about.
Yeah, anytime. Huh?
So, I really love all the ideas, man. This has been great, and I look forward to doing part 3 with you.
Yeah, me too.
All right. Well, have a good day.
We're going, bro.